Sometimes you can know what kind of a story you're going to get by the words that make the title. For example, our story today is One Dark Night.
Susie works in a shoe shine shop. Where she shines, she sits. Where she sits, she shines.
Today I'll be preparing pizza for you.
Mama ananiambia nisicheze kwenye giza.
Safuraisha unaweza shangaa na tabasamu ya usoni tunahakikisha.
Lugha tuseme za kwetu, tusiofie kejeli. Talanta yasonga mbele, maendeleo yang'aa.
Serikali imefanikiwa ama imefua dafu kudhibiti visa vya ajali nchini?
Serikali imefanikiwa kuweka kamera za kidijitali ambazo zinaweza kupima kama gari inawenda kwa mwendo wa kasi.
Kwanza unajua kwamba mashinani hakuna hizo kamera za usalama unazosema.
Tunge sentensi kwa kuzingatia kiwakilishi cha idadi.
Wawili wamefariki.
Upige makofi binti huyu.
Maudhui ni jumla ya mawazo katika kazi ya fasihi.
Ng'ombe shavujika mguu. Na ilivyo kawaida ng'ombe akivujikia mguu malishoni, sharti arudi zizini apate matibabu.
Sasa aliyekuambia mwambie azungumze ni nani?
Inamaanisha kuwa
yajua nini? Tulia kidogo.
Kwa nini hukuniletea?
Hukuniuliza?
Kazi yako ni nini hapa?
Please. Lakini wajua sipenda na kukutendea wewe.
Hayo ni maisha yake. Maisha yangu yamebarikiwa na furaha.
Yule msichana mbona ukamleta ndani yenu?
Tafadhali be moved usiniumize.
Unaona shida ile umetuletea?
Naomba tu Mungu hapo nisiwaifika. Unajua hata siru yeye ni.
Please keep the name of God out of this, Kamau. Take advantage of a situation.
I see.
I don't even understand why you guys are still here. Ruth was too nice.
Kasichana, uko na tumasori twigi abatu hatuna mbele wala nyuma.
I hope I don't need to put anybody out there. Yeah? Why is it I have to do this for you?
Are you a talented artist? Or are you passionate about a topic you want to discuss? But money can be very hard to find for an upcoming artist. Don't worry, Studio Mashinani has got your back. Sign up on ajira.co.ke to book a session with your music and video producers across the country. Work on your music, jingles, spoken words, and even podcasts to realize your dream. All for free. Studio Mashinani, Radani Talent.
I never heard the music so sweet. I repeat.
Well, go on, me brethren, big things are going. Remember, each and every Monday we have to shell down the place with nothing but the best of smooth way the vibes in your favorite station. You know these things, man.
Alafu kila Tuesday, kata simu tupo side giving you Kenyan music from the 254.
And of course, you can spice up your Wednesday by enjoying blazing hot hip-hop and R&B jams.
We don't got no label. She say she want bottles.
Vibes and vibes as we go all across Africa, Kenya, Nigeria, Ghana, all the way to Tanzania to give you nothing but the best on Afro Thursday. Make sure you make a date with us each and every single Friday. With me, DJ_Liza Diva.
DJ Cold.
And me, Wanjiko. This is Club One Extra.
Unanifanya nisikie kunyongwa.
The world of governance is vast and can be alien to the ordinary man on the street.
Critical issues are going to be discussed.
From white papers to policy positions, it is easier to get lost in the labyrinth of words.
Inside Government takes you to key global metropolis where critical decisions are made and where policies are crafted.
We interview policymakers and senior government officials to highlight and enumerate government policies and projects. We take a deep dive into the underbelly of complex red tape to demystify policies across the country, across the world. Join me, O'Brien Kimani, on Inside Government, only on KBC Channel 1.
So the conversation today, we want to first of all understand, how do you raise a boy to become a man?
So the best prediction of the quality of masculinity tomorrow is a father's today.
What are some of the things that can be done to raise this boy actually to become a man, irrespective of his background?
Take initiative, live responsibly, lead sacrificially, love faithfully, and leave a worthwhile legacy.
Ufanisi na hera nchi yetu na wale ambao haja zao umezikabidhi mikononi mwetu. Amen. Clerk, do have Sergeant at times kindly ring the quorum bell for 10 minutes.
Good morning to you, and the Senate is sitting. However, there is a quorum hitch. The prayer has already been said and the chair taken. Quorum is not present yet, and the speaker has directed that the bell be rung for 10 minutes. This is as provided for in the House Standing Order number 39 and 40. That at least 15 senators should be present inside the chambers. Prayer is said and the chair taken for it to be deemed to have quorated. However, if that is not present, then that means that the House has not quorated, and that would mean that the quorum bell be rung. Of course, this is to give room to the members of the Senate who could be running late perhaps, or are yet to make their way into the chambers, to at least hasten their steps and join their colleagues, and also to enable the House raise that much needed quorum for it to be able to commence and transact the business that has been lined up for that particular sitting. And that is what is currently underway. However, today being a Wednesday morning, or this sitting being that of a Wednesday morning, the business that is going to be transacted regards the appearance of the cabinet secretaries before the Senate to be able to respond to concerns or matters that were forwarded to their ministries, matters that could be concerning county, inter-county, national, international, or even regional issues. And these are concerns that are normally forwarded to the ministries prior the cabinet secretary's appearance on the floor of the House. And this morning, 2 cabinet secretaries have been lined up for, or rather to appear before the floor of the Senate chambers. The cabinet secretary for Labor and Social Protection, Dr. Alfred Mutua, as well as the cabinet secretary for Health, Aden Duale, to respond to matters that their ministries received before this particular morning, to be able to give out comprehensive responses. And of course, during the question time, the members usually get an opportunity to ask supplementary questions, of course, that are aligned to the primary question. So this morning, the Cabinet Secretary for Labor and Social Protection will be responding to a question that has been posed by the Senator for Kisumu County, Professor Tom Ojienda. This regards workers in the various sugar companies. One of the questions the member for Kisumu County will be seeking answers to is regarding the rationale behind discharging workers in state-owned industries, particularly in strategic sectors such as sugar and textile industries, and how decisions comply with Articles 41 and 43 of the Constitution, that is on fair labor practices and the right to social and economic security, respectively. Linked to that particular question, also the for Kisumu County will be seeking responses from the Cabinet Secretary to confirm the number of workers affected by that particular restructuring that carried out in Kisumu County, especially in Muhoroni and Miwani sugar companies, and also clarify whether they have received full severance benefits, pensions, and gratuities without undue delay. Under the same question, the member for Kisumu will also want to understand from the Ministry for Labor and Social Protection whether the ministry conducted socio-economic impact assessments before approving the release, and if so, table the reports and indicate the mitigation measures for affected households and host counties. Immediate programs the ministry has introduced to reskill, redeploy, or otherwise safeguard the livelihoods of the affected workers, and how the effectiveness of these programs is being monitored. These are some of the questions that the Cabinet Secretary for Labor and Social Protection, Dr. Alfred Mutua, who's already within the precincts of Parliament and is just waiting to be ushered into the Senate chambers once the House corrects, will be responding to. This is the primary question that the Cabinet Secretary has appeared before the Senate to respond to, but of course we understand there will be supplementary questions from the members of the Senate regarding the concerns around this particular matter that has been raised. The Cabinet Secretary for Health, Aden Duale, who's also expected to appear before the Senate this morning, also has a number of questions that were also forwarded to his ministry prior to this. He will be coming to give comprehensive responses to these concerns. One of the questions is from the Senator for Kirinyaga County, Honorable James Murango. And this question regards public health facilities in Kirinyaga. The member for Kirinyaga will be requesting from the Senate to be provided with a list of all public health facilities in Kirinyaga County that have been issued with title deeds, as well as those that have not. Also, why many public health facilities in the county still lack these title deeds, and also if there are any measures, including budgetary allocations, that the ministry has put in place to ensure that all public health facilities in Kirinyaga County are issued with title deeds. The nominated Senator, Honorable, also has questions for the Cabinet Secretary for Health. These are questions that regard the budget allocations for the Linda, and the Senator will be seeking to get answers to these questions, including current annual budget allocation and how the funds are distributed across counties and public health facilities, including a breakdown of financial year 2024-2025 to date under the Social Health Authority, commonly referred to as SHA, as well as the Social Health Insurance to as chief. Also, if there are any benefit package of Linda managed following its transition under chief, and if so, what the specific changes in coverage, benefit amounts for normal and cesarean deliveries, and eligibility criteria. The Senator will also be seeking to understand from the Cabinet Secretary what safeguards are in place to ensure that funds allocated to Mama are used exclusively for maternal and child health services, and that urgent mothers, especially in rural and marginalized areas, receive full benefits without undue delays. If you're just joining us, is that the House is about to meeting. However, there is a quorum hitch. This is a hitch that might risk the House being adjourned if the quorum is not raised, that is at the commencement of a sitting of the Senate. The Speaker has directed that the quorum bell be rung for 10 minutes. This is to also alert the members who may be within the precincts of Parliament and perhaps running late to get to the chambers, to hasten the get to the chambers, join their colleagues, and enable the House raise that much needed quorum, of course, for the House to commence that business. If that quorum is not raised as provided for in the House Standing Order number 40, at the lapse of the first 10-minute quorum bell and the second minute quorum bell, then the House might risk being adjourned until the next sitting. However, the senators this morning are expected or are scheduled to engage the Cabinet Secretaries, being a Wednesday morning. Let's hear from the Speaker whether the quorum has been raised or a further quorum bell will be rung.
Sergeant at Arms, kindly ring the bell for further 10 minutes.
Well, we have heard from the Speaker that the quorum is yet to be raised, and that the quorum bell continue for further 10 minutes. This is the second round of the quorum bell as provided for in the House Standing Order number 40. If the House fails to raise that quorum, it will be adjourned until the next sitting. I have seen the Senator for Embu County, Honorable Mundigi, just indicating that perhaps could be one senator needed. As provided for in the House Standing Order, at least 15 senators should be seated as when the House or the prayer is said and the chair taken. If that quorum is not present, then the quorum bell will be on for the first 10-minute round. If it lapses without the quorum having been raised, then the second quorum bell will be on, and that is currently where we are now. At least 15 senators are expected to be inside the chambers. Just a few remaining for the House to attain that quorum, and also for it to be able to commence its business. The business declaration this morning is engaging the Cabinet Secretaries, being a Wednesday morning where the Cabinet Secretaries appear before the Senate chambers to respond to concerns. These are questions that are normally forwarded to their ministries prior their appearance on Wednesday morning, just to be able to appear before the House and give comprehensive answers to the matters that were forwarded to them. These are issues that is intercounty, national, regional, or even international level. And when the Cabinet Secretaries appear, then they give comprehensive answers to these matters that have been forwarded to their ministries. And also, senators get an opportunity to ask supplementary questions that are aligned to the primary question. This morning, as I had indicated, have been lined up to appear before the Senate chambers. The Cabinet Secretary for Labour and Social Protection, Dr. Alfred Mutua, is already in Parliament, just awaiting to be ushered into the chamber, take his position, and take the stand to respond to the questions. So if that quorum is raised, then the business will continue. However, as provided for in the House Standing Orders, if that quorum is not raised, then the House might be adjourned. we believe that is not what these senators could be expecting to happen, because normally or many occasions the senators have been up in arms when the cabinet secretaries do not show up when they are invited before the chamber. So this morning, if the cabinet secretaries are here, then it is expected that the senators will also be able to enable the House correct and for the House to commence its sitting, so that the cabinet secretaries who are already within the precincts are ushered in and transact the business that they have come to do in Parliament this morning. We shall continue to take a look at the questions that the senators have for the cabinet secretaries this morning. Once that quorum is raised, however, we shall, without any further delay, now allow me to hand you over.
So let's settle down and start the day's business. Clerk, can we proceed to call the first order?
Order number 1, administration of oath. Order number 4, petitions. Order
Now, honorable senators, we start with question number 113 by the honorable senator for Kisumu County, Professor Tom Ojenda, who I'm informed he is not present today. However, he has delegated the asking of this question to Honorable Beatrice Akinyi. This question on behalf of the senator for Kisumu County. Clerk, can you confirm that the CS Labour is in the House? Honorable CS for Labour, welcome to the Senate once again. For purposes of responding to question number 113 by the Senator for Kisumu County. Honorable Beatrice Akinyi, you may proceed to ask that question on behalf of the Senator for Kisumu County.
Thank you, the Honorable Speaker. As granted by you and requested by Senator Ojenda, this is question number 113. To ask the Cabinet Secretary for Labor and Social Protection. Question 1, could the Cabinet Secretary explain the rationale behind discharging workers in state-owned industries, particularly in strategic sectors such as sugar and textile industries, and how these decisions comply with Articles 41 and 43 of the Constitution on fair labor practices and the right to social and economic security, respectively. Question 2. Question 3, did the ministry conduct socio-economic impact assessments before approving the releases? And if so, table the reports and indicate the mitigation for affected households and host counties. Question 4, what immediate program has the ministry introduced to reskill, redeploy, or otherwise safeguard the livelihoods of the affected workers, and how the effectiveness of these programs is being monitored? Honorable Speaker, on this question, how does the government intend to reconcile fiscal reforms with its constitutional duty under Article 232 of the Constitution on transparency, accountability, and responsiveness to prevent economic dislocations in counties that rely on industries? Thank you, Honorable Speaker.
Now, Honorable CS, I note that your response is fairly long. Since the same has been circulated to all honorable senators, you may wish to paraphrase it, that we save on time. You may proceed to respond, Honorable CS.
Thank you. Good morning, Mr. Speaker, sir, and Honorable Senate. I have a very comprehensive reply, but I'll try to make it condense it because it's a lot of in terms of the facts. Let me start by giving a background because it is important, because it will enable members to understand where we are coming from and also answer many questions before they're asked. Mr. Speaker, the government of Kenya, through the board, the Ministry of Agriculture and Livestock Development, and the National Treasury and Economic Planning, initiated a leasing model for state-owned sugar factories to full privatization. This strategic decision saw the sector, which has long been central to Kenya's rural economy and food security. Mr. Speaker, under this model, Chemilil, Moroni, and Sony Sugar companies were offered to private operators for lease. As you are aware, Mr. Speaker, they had something properly. The objective was to enhance operational efficiency, modernize production, and restore profitability to ensure long-term sustainability of the industry. The government, this is very important, Mr. Speaker, the government, mindful of the human and social impact of the restructuring, acknowledged that the transition could lead to redundancies among workers. Demonstrating its commitment to fairness, social justice, and compassion, it engaged the Kenya Union Sugar Plantation Workers, which is the recognized representative of employees, and entered into a memorandum of understanding on the 7th of May 2025. The MOU, this MOU between the government and the workers, provided a humane and lawful framework for managing the transition, anchored on the principles of dignity of labor, fair compensation, and industrial harmony. It
Tumruhusu Mheshimiwa Rais kukutana na viongozi ili kuelezewa zaidi kuhusiana na mradi ambao atakuwa akizindua asubuhi ya leo.
President William Ruto there, who have just arrived for the launch of the last mile connectivity project here in Nakuru. He has been received by the guests as well as delegates who have joined him here in Nakuru for the launch of the project. Remember this project? The government is not working alone. They're working with development partners such as the World Bank, such as the African Development Bank. And we are looking at ensuring there is grid extension and off-grid extension solutions in areas far away from the grid. And that is a project that President William Ruto is here to launch. He has been touring the Nakuru County, launching various projects, and here is one of the projects that he will be flagging off the RELEC team when it comes to the electrification of the residents of Nakuru County. Remember, this RELEC implements projects across the 290 constituencies across the country. And since the inception of the corporation, the Rural Electrification and Renewable Energy Corporation has invested about 150 billion shillings, mainly from the national government at 85%, that is the exchequer. And this has been complemented, of course, by the development partners at 15%. And this has seen the electricity access grow from 4% in 2008 to over 75%. And our grid right now has geothermal, more of renewable energy, that is geothermal, solar, wind. And their vision is to ensure that we transition to clean energy by the year 2030. And to RELEC works differently from other corporations, where to implement some of these projects, the corporation procures materials and engages frame contractors for labor and transport services. And over time, RELEC has pre-qualified a pool of over 1,000 labor and transport contractors across all the 290 constituencies. Remember, this PPPs, public-private partnership, is a conversation that President William Ruto has been talking about, and it has been close to his heart when it comes to ensuring that he does not work alone but brings on board the private sector when it comes to implementation of some of these projects. And this is one of the projects that has been implemented through PPPs, and this has increased efficiency and reduced the turnaround time of projects implementation. And with, of course, an active presence in every county, RELEC has also a pool of engineers whom you can see on the screen and are joining President William Ruto when it comes to the launch of the last mile connectivity project here in Nakuru. There are technicians, there are surveyors, there are designers deployed nationwide, there are engineers who have accompanied the President of Kenya, that is Rais William Ruto. Now, looking at the overview of the Central Rift region, where we are, the RELEC has established 9 regional offices, and Nakuru is one of the regional offices. There are the counties that have these regional offices include Baringo, Bomet, Kericho, Narok, Nyandarua, and Samburu. And this focus, of course, is on last mile investment in Nakuru. And earlier on, we had talked to the Cabinet Secretary for Energy, that is Opio, and I talking to us about the investment here in Nakuru County, talking about 1.8 billion shillings invested in Nakuru to connect about 23,000 households. And of course, he talked about how this is huge and ambitious when it comes to the government. But then again, we need this power to ensure that we industrialize as a country, and also we ensure that even the rural communities across the country have electricity. But the total investment for the last mile investment in Nakuru, or rather the last mile connectivity project in Nakuru, is about 3.23 billion shillings. And remember, this total investment is a combination of the Kenya Power and RELEC. And of course, with Nakuru having about 11 constituencies, each and every constituency has projects that will be rolled out today. But what the president is doing is flagging off here at Nakuru East Town to ensure that all these projects that RELEC is implementing has the approval of the president of Kenya. And looking at a different facility, we are looking at partnership under the matching fund facility. And remember, this facility has been working for the benefit of Kenyans and for the benefit of the development partners here, where the matching fund program, which of course was introduced in the 2010, was designed to supplement the exchequer funding. And under this arrangement, we have seen RELEC contribute about 5 million shillings per constituency. And this is matched by shilling for shilling with stakeholder contribution, meaning the World Bank, or rather the African Development Bank, who are our partners when it comes to electrification of the grid. Now, notably, our stakeholders are not subject to any maximum contribution limit. Remember, yes, RELEC is contributing a maximum of 5 million shillings per constituency, but for the stakeholders, they can pump in money as much, even shilling by shilling, yes, but there is no maximum contribution limit. Now, through the matching fund, RELEC has developed a participatory, innovative approach in financing community projects through a cost-sharing arrangement with the Constituency Development Fund. Remember, the government cannot work alone. RELEC cannot work alone. There has to be a collaboration between the county government and also the Constituency Development Fund and also other stakeholders. Now, this program has been critical in augmenting exchequer's funding, achieving more projects. And so far, RELEC has mobilized about 4 billion shillings. On your screen, you can see the President William Ruto there. He's going to launch a school right here in Nakuru County. The school is called Susan Kihika Primary and Junior School, and it will have ECD classes. It will have primary and junior secondary. And earlier on, the Member of Parliament for Nakuru Town East, that is David, talked to us about this school and said that there is need for a school within this Nakuru Town East due to, of course, the education program that the government is pushing for to ensure that every child has an education. He's right there on your screen. You can see him now going to launch the last mile connectivity project. And of course, you can see he is about, we can see the excavator on the screen.
Imefunguliwa na sasa twende kwa ground breaking. Ground breaking yenyewe Mheshimiwa Rais
the TVETs to get new skills and get back to work, but they were not set out with nothing. They were let out with enough money to be able to live comfortably. I submit.
Senator Boni.
Thank you, Mr. Speaker. Mr. Speaker, the minister knows that the cabinet and made a decision on privatization. However, this was varied to listen. Minister, since you sit in cabinet, why did you take the initiative to carry out impact assessment? You have now visited our people, families running into millions of Kenyans with challenges that must be addressed by the government. Why didn't you take the initiative?
Senator for Nairobi City County.
Speaker, I used to hear this thing called all of government approach shouted from podiums. I'm surprised that the CS in his response is actually telling us that we directed the questions to the wrong ministry, that we should have looked for the CS for Treasury who were involved directly. Because he sits in cabinet, he should supply some of the answers to the questions that we are raising. CS, you have a responsibility as a government to protect your people, to find employment for them. And those that you found in employment, to try and sustain them in employment for as long as possible, because they are breadwinners for their families. When you allow private entities, such as this lessees, to be the ones to exclusively determine who they need to continue working or not, you are abdicating your responsibility. How is it possible, CS, that the government has no role whatsoever in making those determinations in order to protect its own people? Thank you, Honorable Speaker.
Senator for Tana River County, the Honorable Mungatana.
Thank you, Mr. Speaker. Mr. Speaker, listening to the minister, he gave a figure of 1,743 people affected in these redundancies. And the senator who was asking this question was specific about Chemilil, Muhoroni, and Miwani sugar companies. Mr. Speaker, what this Senate wants to know is whether there was full compliance of Section 40 of the Employment Act. It appears to me that this minister was giving us big figures, 1 billion, whatnot, but he's not telling us whether there was full compliance. In fact, Mr. Speaker, he's saying that there might be future payments. So the first issue is whether there was actual full compliance. The people who are let to go, 1,743 people, Mr. Speaker, in your county, those are a lot of people. How many were actually paid? And Mr. Speaker, just complementary to that, what is the plan of this minister to get those people reabsorbed into employment? Mr. Speaker, we need to be proactive as a government. You can't let more than 1,000 people unemployed, and then you are not giving. Don't give us figures. Tell us whether you have actually settled those. Because it appears there's obfuscation in terms of the explanations there. I thank you, Mr. Speaker.
Senator for Taita Taveta County.
Yeah, thank you, Mr. Speaker. Mr. CS would want to know if the employees would be paid before they leave, and how much it would be, or they would be paid after. In fact, the CS should give us a list of how much each will get, because he has indicated that if you are 30 years and you're supposed to work maybe up to 60 years, then you'll be paid for the rest of the time that you're supposed to work. So how much will each person get as severance allowance? Number two, if they're not paid before they leave, we have an instance where medical workers were eased off in 2000. Up to now, they have not received their severance allowance. I know some of them have died. Some of them are sickly now. They are quite old. An auntie of mine was working for Ministry of Health. Up to now, they have not been paid. So we want to know how much each should earn, when they would be paid, and in fact, they should enjoy their salaries before they are eased off, and when they get their lump sum, that is the time when they can be let to go. Thank you, Mr.
Senator for Nandi County, the Honorable Chiranke.
Thank you, Mr. Speaker, sir. I'm surprised by the response of the CS Mutua because Chemelil is part of Nandi County. And from his response, Mr. Speaker, I need clarity. He indicates that only representatives of, Mr. Speaker, if you can indulge me, representatives of Kisumu, Migori, yet Nandi and Kericho, which is part of Chemelil, has not been captured. So can you clarify? And then, Mr. Speaker, we are coming to the tail end of leasing process. What is the fate of unpaid 15 billion and 3 billion consecutively that are supposed to be paid to workers? Are they left to the dogs, Mr. Speaker? Can you clarify on that? I yield.
Senator for Kitui County, the Honorable Ombo.
Mr. Speaker, very interesting responses. Interesting because the Speaker, in the words of the CS, and clearly has just let workers be dealt with by private investors in determining who continues to work and who has got to go home. But Speaker, most importantly, the question that I have for the CS, after a determination has been made of who is going to leave and who is going to be retained, whose responsibility will it be to pay the gratuities and the benefits and to ensure that those payments, Mr. Speaker, are in time? Because there is a gray area there. Who exactly is it that will ensure that these gratuities and the benefits are paid in time to the workers that will have to be let go? I thank you, Mr. Speaker.
Senator Mbugua.
Thank you, Mr. Speaker. I would want the Cabinet Secretary to tell this House the level of involvement of the Workers' Union in this engagement and also the involvement of the respective governments, because this is a matter which affects the people in those counties. Thank you, Speaker.
Honorable CS, you may now proceed to respond to those questions.
Thank you, Mr. Speaker, sir, and thank you, members, for those very good questions. It is important to note, going for the first question about non-staff and the question about their salaries and the community. Oh no, I answered that one. Sorry, Senator Boni Alwale, about the socio-economic study. It was done when the paper came to cabinet. Yes, a study had already been done on the impact of and revival. And the socio-economic study is not just an economic study, or when Treasury presented and agriculture, of just the people who are hired and who maybe would lose their jobs or earn their jobs. It was a study of the general impact of the country and of the region. Because you're talking about a sector that was basically crippled. We're talking about reviving a sector, creating wealth, so that majority of people, parents who had given up, farmers who had given up, could now go back to growing sugar and making money. It was going to even inject money into the kitty to assist in the development of the country. So yes, there's a lot of thinking that went into it, and how do we revive this? Will it just be business as usual, government pumping happening, or do we need to think out of the box to revive this one and make it a working system? And as you're aware,
Kiratina hamjambo. Hey, sasa mi naona wananchi wamejajaa hapa. So tutasimama wapi? iende chini huko. Iende chini.
All being paid their dues, and they all as per their contracts. If you're permanent and pensionable, you are being paid for the time that you are supposed to work. If you retire, if you're sent home at the age of 30, you're permanent pensionable, you're compensated for the 25 years that you should have been working to your retirement. If you're on contract, up to your contract. We have been assured that human rights and that workers' rights are followed. This takes me to, I don't have the figures of the number of people who are totally...
Wananchi wa Kiragita hamjambo. Kiragita hamjambo. Nakuru assalamu alaikum. Bwana Yesu asifiwe. Hebu munisalimie hewani hivi watu wa Kiragita. Hey. Naona mko area. Sasa ndugu zangu watu wa Nakuru, mimi nimefika hapa leo kwa sababu ya mambo ya maendeleo ya Nakuru County. Na mimi niliwaeleza wakati tunapanga maendeleo ya Kenya, lazima tupange maendeleo ya Nakuru County. Na leo mimi nimekuja hapa Kiragita. Nimeletwa na huyu mbunge wenu Bwana Gikaria. Sindio? Na nimekuja hapa kwa sababu ya masomo ya watoto wenu. Mimi najua nyinyi ni watu wa bidii, lakini watoto wenu wanasoma shule iko mbali. Wengine wanavuka hii barabara, na kuvuka barabara iko na hatari yake. Wengine wanaenda shule naambiwa iko huko mbali, mnapitia kwa mashamba hapa chini. Sindio? Lakini basi, mimi nimefika hapa leo, na mimi nataka nimshukuru Mama Susan Kihika, kwa sababu yeye amekubali hii shamba ambayo ni ya county tutumie kujenga shule ya watu wa Kiratina. Nataka nimshukuru ndugu yangu Bwana Gikaria kwa sababu ya kuweka pesa ya CDF. Lakini ameniambia, mnanisikia? Ameniambia ya kwamba ile pesa ameweka hapa anahitaji shilingi milioni 15 ingine. Na mimi nimekubali. Mimi nitampatia huyu mbunge wenu milioni zingine 15 tujenge hii shule na tukamilishe. Nataka munisikize watu wa Kiragita. Kiratina. Kuna ingine inaitwa Karatina. Lakini hii yenu inaonekana ni Karatina kubwa. So inaitwa Kiratina. Ile kubwa. So watu wa Kiratina, nataka munisikize kwa makini. Hapa tunataka kujenga comprehensive school. Sawa sawa? Hapa tunaanza kesho, sio kesho kutwa, kesho. Nani nimemwambia huyu contractor ako hapa, bwana Madhea. Naitwa Madhea, sio? Wewe bwana Madhea, kesho asubuhi saa 12 trakta iwe hapa inaanza kujenga shule ya watu wa Kiratina. Na mimi nataka nirudi hapa tarehe 20 Januari nikuje nifungue shule ya watu wa Kiratina hapa. Nyinyi mnanielewa? Sasa wewe Kigaria na huyu contractor wako, vile mtafanya shauri yenu. Mimi nakuja hapa Januari kufungua shule, kwa sababu iko pesa ya kutosha kujenga hii shule. Shule tutawajengea hapa ni ya shilingi milioni 70, ndio tunajenga shule hapa. Kiratina hoye! Kiratina hoye! Munasema tujenge shule, watoto wenu wasome, ndio wapate nafasi kama watoto wa Kenya wengine. Tuko pamoja? Na tukifungua, mimi nitaleta hapa walimu wa kwanza 15 ambao watakuja kusaidia. Na kama kuna vijana wa hapa Kiratina, kama kuna vijana wamesomea elimu, wewe Mheshimiwa Kikaria unitafutie majina ya hawa. Kama kuna mtu yeyote ako na namba ya TSC ya watu wa Kiratina hapa, tutamuajiri Januari aanze kusomesha watoto wa Kiratina hapa. Kiratina hoye! Kiratina hoye! Munasema tujenge shule hapa. Sasa Kikaria, huyu contractor wako awe na shift 3, moja 8 hours, ingine 8 hours. Tuko na vijana wengi ambao wako na tayari kufanya hiyo kazi. Vijana hoye! Muko tayari ama muko tayari? Nyinyi ni watu wa kujituma ama ni wa kungojea? Nyinyi ni watu wa kujituma? Mutajituma tujenge shule ya watoto wenu? Basi Bwana Mudhea, saa hii nishampatia pesa huyu jamaa. Asiwaambie hatijapatiwa pesa. Nishampatia pesa saa hizi. Kesho asubuhi akuwe hapa aanzishe kazi ya hapa. Tumekubaliana? Kwa sababu jameni, mimi naona nyinyi ni watu wa bidii. Mimi nimeona watoto hapa si wachache. Na mko na bidii. Hawa watoto ni wa hii boma? Ni wa hii kijiji yenu? Ama mmetembelewa na watoto ni wa hapa? Na mko na bidii kweli. Na kwa sababu nyinyi ni watu wa bidii, hata na sisi tutakuwa wa bidii. Tuwajengee shule tukamilishe. Ama namna gani Kiratina? Namna hiyo? Vile vile mimi nataka niwaeleze, kama kuna watu hapa, niko na waziri hapa Upio Wandai, waziri wa stima. Wewe bwana Wandai, kwa sababu leo pia tumeanzisha hapa Nakuru program ya kuunganisha wananchi kwa huduma ya stima. Sehemu zote, kama kuna nyumba bado haijawekwa stima, waziri yuko hapa, Gikaria yuko hapa, na Gikaria ndio chairman ya kamati ya bunge ambaye inasimamia mambo ya stima. Mpigeni huyu chairman wenu makofi. Kwani nyinyi mnafikiri huyu Gikaria ni mtu mchache? Mnafikiri ni mtu mdogo? Yeye ndio mwenyekiti bunge mzima, Kenya mzima, ya kusimamia mambo ya stima hii Kenya. Tumekubaliana? Huyu Gikaria anatosha ama atoshi? Si anatosha? Kwa hivyo mimi nataka mbali na kujenga shule, tunataka pia hapa sehemu yenu, kama kuna mahali mnaweza kunipatia, naweza kuwajengea soko. Sijui kama iko mahali ya kujenga soko hapa. Wewe bwana Gikaria utapanga? Hata kama ni soko ndogo hapo, nipangie hawa wamama wa hapa wawe na mahali ya kuuzia mazao yao, ili tuweze kuinua sehemu hii uende kwenda mbele. Tumekubaliana? Vijana hoye! Vijana hoye! Nataka mnisikize kwa makini. Sawa sawa? Mimi leo naenda kuanzisha program ya affordable housing. Hapa hapo Lanet, hapa chini, hapa karibu na ikwenu. Sawa sawa? Hapa pipeline. Pale pipeline mimi nahitaji vijana 2,000 wa kufanya kazi ya affordable housing pale. Vijana wa hapa mko tayari? Wasichana na wavulana. Tunahitaji vijana 2,000 wa kufanya kazi pale pipeline. Kwa sababu naenda kuanzisha mpango wa kujenga nyumba 2,500 ya watu wa Nakuru County katika ile program yetu ya affordable housing. Na katika hiyo affordable housing tuko na ajira ya vijana. Kama wewe ni plumber, ama wewe ni electrician, ama wewe ni carpenter, ama wewe ni mason, hata mtu ya mkono, wewe unaweza kushindwa kusukuma wheelbarrow peke yake? Ama namna gani? Si tunasema kila mtu? Nasikiza wewe mungwana wa Kiratina. Dunia hii maneno ni kujituma. Si ndio? Dunia hii ni kujituma. Hakuna kazi itakutafuta kwako. Lazima utoke nyumbani, ujitume ndio uweze kujipanga. Kwani nyinyi si mnaona hata mimi ni mtu ya kujituma? Kwani wangapi wamefika hapa? Rais wangapi wamefika hapa? Hata mawaziri wangapi wamefika hapa? Hata viongozi wengine wangapi wamefika hapa? Dunia hii nawaambia mambo ni kufanya nini? Kila mtu tujitume jameni, kwa sababu Kenya haiwezi kusonga mbele kama hatuwezi kujituma tushughulikie mambo ya taifa letu la Kenya. So leo mimi naenda kufungua program ya nyumba 2,500. Tunahitaji vijana 2,000 wa kufanya kazi pale. Nilikuwa Elbagon juzi. Tunajenga nyumba zingine 2,000 kule Elbagon. Pia hapa Nakuru Town ama Nakuru County tunajenga nyumba 21,000 na tunataka vijana wajumuike katika kufanya kazi hiyo, na vile vile tuhakikishe ya kwamba vijana tunawaunganisha na nafasi ya ajira. Tuko pamoja jameni? Tuko pamoja? Vile vile mimi leo Nakuru naenda kufungua barabara zenu. Nyinyi mumesikia hii barabara inatusumbua ya kwenda Nairobi. Msongamano wa magari. Watu wanalala kule Naivasha, wanalala Gilgil wakijaribu kutafuta barabara ya kwenda Nairobi, ama wengine wanaenda Malaba. Si ni kweli? Sasa tumekubaliana hii barabara yenu tunapanua. Tunaweka badala ya leni 2 tunaweka leni 6. Kutoka Nairobi mpaka hapa Nakuru. Nyie mnanielewa? Na mimi nakuja kuanzisha hiyo mjengo mwezi ujao, mwezi wa 11, next month. Mimi nitakuja hapa. Kwa sababu hakuna vile Nakuru itabadilika. Itabadilishwa na miradi na mipango ya maendeleo. Ama namna gani jameni? Nakuru hoye! Nakuru hoye! Munasema tuendelee na kazi ama munataka fitina ianze? Na mimi nawapenda sana watu wa Nakuru. Nyinyi ni Wakenya kamili. Nyinyi ni watu mumeungana. Mumekataa ukabila. Mumekataa tugawanywe. Mumekataa kisirani na chuki. Sisi wote ni ndugu moja. Waswahili wanasema umoja ni nini? Si umoja ni nguvu jameni? Si tuungane, tushirikiane, tufanye kazi pamoja. Wangapi wanasema tushirikiane pamoja, tufanye kazi pamoja? Nakuru hoye! Basi, kwa sababu mimi naenda kufanya kazi hiyo ya affordable housing, alafu nitaenda kutengeneza barabara ya kule Naivasha, alafu nitaenda kupatiana title deeds huko Gilgil, kwa sababu tunataka kuendesha Nakuru kwa kasi, ndio nafasi ya kubadilisha Nakuru ipatikane. Hapa niko na viongozi wengi. Niko na mama wetu Governor Susan Kihika, mpigeni makofi. Sema jambo Governor, simama hapo.
Kiratina hamjambo. Mumefurahia rais kufika hapa? Mulijua kuna siku rais wa Jamhuri ya Kenya atafika hapa? Sasa Mheshimiwa Rais, we are very thankful. Haya, ngojeni niwaambie, nikisema harambe hiyo mnamuonyesha mnionyeshe. Si ndio hiyo? Harambe! Harambe! Mheshimiwa Rais, umeona ile maneno tuko nayo hapa Nakuru. Lakini the reason tunasema hivyo ni kwa sababu ya ile kazi unatufanyia. Na nimshukuru sana Mheshimiwa Gekaria, Mheshimiwa wetu MP, kwa sababu sababu tulipokuja hapa na yeye wakati tulikuwa tunatafuta kazi ya governor na MP, tuliwaambia sasa mkitupea kazi lazima tutajenga shule hapa so that watoto wetu wawache kucross ile barabara yenye ni very busy na wawache kugongwa na magari. Na kweli Mheshimiwa Rais, umeona ya ukweli hapa, watoto ni wengi. Kazi nayo hapa iko juu na watoto ni wengi. Na si pia mnajua hata governor amepata watoto juzi. Kwa hivyo ndio wawili kama zile terms, si ndio hiyo? Sawa. Kwa hivyo sisi kama watu wa Nakuru County, Mheshimiwa Rais, sisi tunasema kazi kwanza, siasa baadaye. Si ndio hiyo? Lakini nikisema fire, si mnajua fire? Fire ni fire. Mnamuona mwenyewe. Na sasa na Your Excellency. Noma, si noma. Haya, Your Excellency. Pia hapa, hebu sikizeni watu wa Keratina. Hapa kwa shule penye Mheshimiwa Gekaria with his good vision yenye amesema tujenge shule, pia tulibakisha kidogo tuweze kuweka soko vile tu umesema Mheshimiwa Rais. Kozi ukiangalia hapa pia soko ni muhimu kidogo tu, na pia kama county tumeongeza pesa kwa ile soko ya free area ili tuweze kuendelea kuipanua. Na pia basari, shule ikimalizika, si mimi mtanikuta niwapatie basari watoto waweze kusoma, kwa sababu tulisema hakuna mtoto atakaa nyumbani akose kusoma kwa sababu mzazi hana uwezo, si ndio hiyo? Na on top of that pia niko na school feeding program ya hawa watoto. Kwa hivyo nitafanya makosa nisipotaja. On top of hawa watoto
facilities and private level at level 5 and 6. Section was Kenya shilling 17. But if you look at the fee for service model under SHA stock shift, reimbursement is based on the actual service rendered at the tariff rate and passed by the House. And then there's standardization of the reimbursement. Now, faith-based, private, and public, women can access normal delivery, and SHA will reimburse 10,000. For cesarean section, 30,000 because of equity. Whether they go to public hospitals, whether they go to private hospitals, whether they go to faith-based hospital. And then eligibility is different. Under the Linda Mama, eligibility was only targeting pregnant women nationally, but adolescents and undocumented mothers were often excluded. But now if you look at the Linda Jamii or the SHA shift under this transition, indigent households are identified via a very proxy mean testing as per the law, as per Section 27 Social Health Insurance Act of 2023. So pregnant, adolescents, and newborns are all included through a very targeted using a temporary ID, and the entire household is covered under the shift comprehensive. So where the teenage mother can either use her birth certificate, she can use her parents' identification, and the system has created a special to identify those important section of our mothers who are the teenage mothers. Question 3 about the safeguards. Honorable Speaker and members, several safeguards have been initiated to ensure that the funds allocated to sponsored indigent programs are used exclusively for maternal and child health services, and that vulnerable mothers receive full benefits without undue delay. And what have we done? We have done, number one, we have introduced legal and policy safeguards. The Social Health Insurance Act of 2023, which this House has passed, mandates proxy means testing to ensure that only eligible vulnerable groups are covered and this is anchored in the use of the funds within Section 27. And more important, digitization and transparency. Reimbursements are processed through digital platforms that validate service for payment. They minimize fraudulent claims. Real-time registration is done through digital health platforms. Community health promoters help us to instantly enroll, to ensure timely access, especially in the most remote part of our country. Then there's equity and beneficiary safeguards. SHA has given priority to the most vulnerable households to ensure that the once registered indigent beneficiaries are entitled to maternal services at the point of use, without facilities prohibiting from levying additional fees for covered services. And finally, I think the other question was, what has the ministry taken to access to Linda Mama services in the under-resourced, understaffed health facilities, and how it's addressing those barriers which are faced by our mothers. Honorable Speaker and members, to ensure access to maternal service in under-resourced and hard-to-reach areas, the Ministry of Health, through the Social Health Authority, has implemented the following measures. Number one, digital registration deployment. SHA has deployed real-time digital registration platforms at all of our over 10,000 contracted health facilities countrywide, both public and faith-based. And this allows pregnant women, including those in remote areas, to be enrolled instantly, immediate access to services without the administrative or financial delay. The one is the community linkage through the community health promoters, who have been empowered to identify, to register, and to link pregnant women, particularly the adolescents and the vulnerable households, to the nearest accredited facility. This strengthens the last mile access, and it will ensure inclusion of mothers to hard-to-reach areas. Lastly, Honorable Speaker and members, we are targeting the under-resourced facilities. And how do we do this? The increased and the standardized fee for service tariff for maternal services is designed in order to insensitize both for the private and the faith-based facilities, all areas to remain contracted and sustain quality maternal care. And that's why I am very specific that in some of our most remote rural parts, the faith-based health facilities are available, and that's why we don't want to discriminate. Mothers can go to either faith-based facility, they can go to private, if facilities are not available in that area. And then the last one is to provide of the outcome achieved through the Linda Mama program since inception. Honorable Speaker and members, investing in maternal health is a proven strategy for improving the outcomes data, democratic and health survey, which demonstrates progress, and it attributes in part to increased access facilitated by the Proceedings program. And reduce maternal mortality. The maternal mortality rate declined from 362 deaths, 100,000 live births in 2014 to 355 deaths per 100,000 live births in 2019. Mr. Speaker, I am figure. There are many, many mothers. Kenya should not be at 355 per 355 mothers die for every 100,000. our peers, our regional neighbors are doing better. But the biggest problem I have for now is that even the data.
Kama wewe hauna kitambulisho, si ndio? Hata kama umefika miaka 20, 30, 50, unajua kuna watu wanaogopa ya kwamba wakienda kuuliza ya kwamba kitambulisho wataulizwa ulikuwa wapi. Maneno ya vetting, maneno ya kuulizwa maswali, tumeondoa hiyo mambo yote. Wewe enda utapatiwa kitambulisho bila malipo yoyote. Tunaelewekana? Na nimeambia wale wote ambao wanahusika, mtu asiulizwe ati wewe ulitoka Narok, atienda pata kitambulisho Narok. Ati wewe ulitoka Busia, wewe enda tafuta kitambulisho Butia. Ati wewe ulitoka Nyandarua, hakuna kitu kama hiyo. Mwananchi akiwa Nakuru, apatiwe kitambulisho Nakuru. Tunaelewana jameni? Alafu basi, mimi nataka nyinyi, kila mmoja wetu nataka ajiandikishe kwa SHA. Kila mmoja wetu, kujiandikisha ni bure. Mimi nataka nikuulize wewe mwananchi, jitambulishe, enda ujiandikishe kwa SHA. Wangapi wamejiandikisha kwa SHA hapa? Hebu nione watu wamejiandikisha kwa SHA. Na nyinyi wengine mnangojea nani? Mnangojea Yesu arudi? Mtajiandikisha? Tunataka kila mtu ajiandikishe, ndio tuhakikishe kwamba tuko na madawa ya kutosha, tuwe na madaktari ya kutosha, na tuwe na vifaa ama equipment ya kusaidia katika matibabu ya kutosha. Kwa hivyo asanteni sana watu wa Kiratina. Wapi huyo contractor? Contractor wetu wako wapi? Wapi yule bwana Madhea? Wapi bwana Madhea hapa? Ndio huyo. Huyu ndio contractor wetu bwana Madhea. Huyo hapo, huyu. Huyu bwana Madhea, kesho my friend. Bwana Madhea, kesho saa 12 uwe hapa. Na ile kazi itafanyika hapa, itafanywa na vijana wa Kiratina. Nyinyi vijana mko tayari? Vijana mko tayari? So kuanzia kesho tunangangana na hiyo kazi, tunataka hao watoto wapate mahali ya kusoma. Asanteni sana watu wa Kiratina, mimi nawapenda sana, nawatakia baraka ya Mungu, na mimi nitarudi hapa tena kwa shughuli ya mambo ya maendeleo yenu. Thank you very much. God bless you. Asanteni sana, Mungu awabariki.
In our country has increased from 52% in 2014 to 60% in 2019, indicating improved access. But when I walk counties to do the SHA rollout, a number of leaders are not agreeing with this figure, and I agree with them because the data is old. The data is maybe 5 years, 6 years, 7 years. So we need to find out the correct data, and I am ready, willing, Mr. Speaker. I have set up a committee led by the Director of Medical Services to make sure that we get the right data, how many of our mothers die, to make it a mandatory that every health facility reports maternal and child deaths in our country. That is for Honorable Senator Mutinda, Your Excellency. Thank you.
Senator Mutinda, do you have any supplementary questions?
Bwana Waziri, thank you for your responses. And I want to agree with you that there is no single mother who becomes pregnant and wishes to die or even lose their child. I'm happy that you also note that. Now, I sit in the Committee of Health, and yes, Mr. Speaker, through you, we've really been visiting different counties, and recently we were actually in the Eastern region, and that yes, when we ask the question of if SHA is working, the response is that SHA is working. I want to narrow my follow-up questions, Bwana Waziri, to part C. When I asked about the issue of the funds, your response specifies and says that the Chief Act 2023, Section 27, has taken care of that. But when I look at Section 27, Bwana Waziri, it is much more on the contribution of Chief. I would want of the measures that have been put in place, that there is a follow-up from SHA that ensures that the funds that come through Linda Mama, as much as you've explained that Linda Mama is not in place, but it has been substituted and the services are in place and are being offered. What is SHA doing to ensure that there is a follow-up of these funds specifically for Linda Mama? At the same time, the issues of capacity building, Mr. Speaker. Waziri, you've talked about digitalization and transparency. I have noticed, yes, your team is on the ground doing the digital registration, especially to these young teenagers under 18 who have no. But what capacity building measures have you put in place that even the young mothers who are not aware that they can actually get these services, they can know that these services are still being rendered? What has been put in place to ensure that there is that capacity?
Yes, Senator Mutinda, go straight to the question, please.
Okay, Mr. Speaker. I know that of the young mothers we've met in hospitals, they have no even phone, they have no documentation has been put in place to ensure that even those ones with nothing are being assisted with the shortest time, because sometimes they always explain to us that they have just been kept in hospital, just waiting, to hope that things will be sorted within the shortest time possible. Lastly, Mr. Speaker, is mechanisms to monitor transparency and accountability of SHA funds. Linda Mama, when they are remitted to the health facilities, and how SHA is looking forward to sort the challenge that is being experienced by most of the health, by this delayed reimbursement of the SHA fund to the health facilities. Hence, they are not able to continuously sustain offering the best services that they're supposed to offer.
Honorable
Thank you, Mr.
CS,
Speaker.
you may proceed to respond.
Honorable Speaker and the members, the current Linda Jamii budget is 900 million. And this budget is supposed to cover 400,000 teenage mothers across our 47 counties. And every year, the estimates, different counties, the estimate is about, we have in our country about 400,000 teenage mothers. And they are the ones who are to be covered by this budget. So from our record at SHA, through digitization, we have covered 22,000, paid for and went home. The question is, how do we trace them? How do we get them? We have the numbers. We have counties with the highest numbers I can give. We have counties with the lowest numbers. County like Kakamega, Kilifi are the highest numbers. What are we doing to mobilize? We are talking to governors, we are talking to leaders, both political, church leaders, and we are mobilizing a very robust registration of teenage mothers and going with all our county governments. Everywhere we go, we give them the numbers and we tell them, these are the teenage mothers who exist in this county. These are the health facilities and who have accessed this free service. Please help us mobilize. We are using our communities, and we are even urging the House and the leaders to make sure that all of us together, we are not promoting, we have no choice. They are our children, and we must protect them. So, including the leadership here, we really want to make sure that we increase our number from the 22,000 teenage mothers who have already and cover all the 400. To date, Honorable Speaker and members, we have 476,553 deliveries, normal deliveries. And we have another 150,602 who went through cesarean delivery. Our community health promoters are well-trained, particularly in terms of registration of teenage mothers. And so far, the claim that SHA has paid, particularly on maternity, is about 9.7 billion to all health facilities at all levels in all the three categories of private, public, and faith both. So if you look at the Facility Improvement Fund Act, which ring-fenced funds at the facility for the improvement of those services. And these funds, to the good wisdom of this House, you have decided that the reimbursements must go direct to the facility, not to the county treasury fund, so that the facility can buy drugs, the facility can even hire healthcare workers, either on contract or locum, and all these make sure that the health facilities are managed better through the reimbursed funds in order for us to achieve key health indicators and priorities, Mr. Speaker. Thank you, sir.
Senator Mandago.
Thank you very much. My supplementary question to the CS is on the issues of reimbursement and clearance of mothers to leave the facility. Apparently, there is delay in hospitals so that the mother can take another 3 days, and the facility says SHA doesn't cover the 3 extra days in the facility, and that is what is bringing the trouble of detention of mothers in facilities. I'm specifically speaking of Moi Teaching and Referral Hospital, where reported to me as the area senator. Apparently also I'm the chair of the senatorial committee, so I can respond. Since you are here, I think it is a good opportunity to respond to that so that all other facilities in the country can be able to facilitate matters as soon as they are due for release from facilities. They are immediately released, regardless of the processes that the hospitals have to continue with billing and so forth, so that SHA doesn't pay for them, but they have stayed another 3 days, and they are, and in the process they actually pay more than SHA, what SHA is paying for them. Thank you very much, Speaker.
Senator Majayo.
Asante mstahiki Spika. Mstahiki Spika, swali langu kwa waziri afya ni kwamba kulikuwa na masikizano ama mkataba hapo awali ya kwamba wagonjwa wanajiwasilisha katika hospitali za kiwango cha kwanza, cha pili na cha tatu, yaani level 1 na level 3. Hawa wagonjwa hawa ama kina mama wanaokwenda katika zile hospitali ilikuwa watapata ya bure, ya kwamba wakiingia pale watapewa matibabu na alafu wataenda zao nyumbani bila kulipa chochote, wakati wakiwa wao ni wasajili katika yale mamlaka ya afya ya jamii ambao ni SHA. Sasa nauliza, ni kwa sababu gani bwana waziri, katika ule mkataba ambao ulikuweko baina ya mamlaka ya afya ya jamii ambao ni SHA na vile ambavyo ulipeana mkataba huo, ya kwamba watu wakija, wakina mama, watoto, watu wazima wakienda, ikiwa wao ni members wa ile SHA, wasiweze kulipa, lakini hivi sasa tunaona ya kwamba katika mahospitali yetu wanalipa. Je, iko uwezekano wa kwamba wewe unaweza kuregesha tena hiyo amri na ukawaambia ya kwamba watu wote, kina mama na watoto ambao wako na wao wamejisajili na SHA wasiweze kulipa malipo hayo, ili turudi pale pale tulikuwa zamani ya wakipata matibabu wanaondoka, watapata matibabu bure, alafu waende zao nyumbani. Asante Bwana Spika.
Aaron Cheriot. Now, honorable senators will know that question number 116, which is the next question after this, essentially deals with matters surrounding SHA. So you may want to hold on some questions and ask them when we are dealing with that particular question.
Mr. Speaker, if that is a guidance, then I follow the...
Thank you. Senator Shakila.
Thank you, Mr. Speaker. Mr. Speaker, my question is regarding SHA. We know since SHA took over, it has been facing a lot of challenges.
Senator Shakila, that we will be moving to interrogate.
So I hold my question. I'll do that.
You'll get an opportunity at that time.
Okay.
Senator Boni.
Thank you, Mr. Speaker. This issue is a matter of life and death, and the minister has a very good opportunity to speak to Kenyans about this. Minister, a living patient, Sheila Litunya Omungala from Kakamega, Butere, working in Nairobi. She went to deliver. She had paid for SHA. She's a small mamamboga in this town and what have you. She had paid for SHA. She had done her part. But at the end of the process, with a bill of 51,000, of which thankfully SHA paid around 400,000. 200,000, they told her, you must pay. Minister, this is the elephant. When a poor woman like that who had played her role, she had paid. She then has to pay 200,000. Then they can't say SHA is working. Because these are the same women, when she had her first and second child under Linda Mama, she just went, delivered, and went back home. But in your case, she's being challenged, despite being a member, you must pay. I want to thank the Senator of Nairobi, because I had to use his office to get to social workers for me to get that bill to be waived. Not many patients have access to us leaders. So, Minister, my question. Yeah, I had to pay it because I feel a lot of pain about Litunya.
I share your pain, but yes. Go straight to the question, Senator.
So, Minister, the question you must answer for Kenyans. This extra bill, which I expect people to pay, why don't you accept that it is a statement of a failed system of funding, and therefore you rework it so that patients, my dear brother, can enjoy in the same manner they were enjoying under Linda Mama. When you convert Linda Mama into Linda, that is fraud, because in Jamii, people, and Dr. Moth is there, some of the people in the Jamii have got backache, weird things, but delivery of mothers is a serious emergency which is life-threatening. You've just told us about the 355 women who die out of 100,000 people. That should not happen. Governor Wamatangi has shown you the way in Kiambu. He has sustained 8 months without a single maternal death. It's doable. And because my younger colleague is there.
Senator Beatrice Akinyi.
Thank you, the Honorable Speaker. Welcome, CS Duale, to the Senate. And from the onset, I want to say that one of the best things that happened in this country. My question is, Honorable Speaker, CS, are there health facilities in the Republic holding mothers that have delivered non-payment of bills? And what is the policy of the ministry? Because the ministry is the custodian of the sector's policy. It is sad that there are children who have to spend their first days in hospital because their mothers or their parents or their parents cannot pay bills. Thank you.
Senator.
Thank you, Mr. Speaker, for the opportunity to contribute to supplementary questions to the CS. One, I would like to ask the CS that anti-D for ESSA's negative was a part of the Linda Mama package, but it was scrapped off. So currently, most mothers with this condition are not getting it because of it. Secondly, I would like to inform that sometimes patients are not...
Senator Nabwire, you are entitled to just one supplementary question, which you've already asked. Kindly take your seat. Senator Hamida.
Thank you, Mr. Bwana Waziri, looking at Linda Mama, unfortunately, free things also at times, they come with a price. We have going to, when we inspect hospitals, we have found shortages of staff, high workload, inadequate equipment, inadequate beds, delivery theaters are not there. And seriously, it's such a pain to see that, imagine, you have a maternity without theaters. So I'm just wondering, is there any awareness? And also looking at our awareness on women, especially the young mothers, that at times the marginalized groups need to know about the right of the Linda Mama and what's covered and how and the access to Linda Mama. One last thing is that the tracking and accountability, Waziri, how do you monitor for empowerment working? How do we link that monitoring of these programs to outcomes, looking at mortality? Bwana Waziri, I had a motion here in Parliament on postpartum depression, mothers on mental health. I think my motion went through, and so I think the hospitals need to have a wing for postpartum depression, Bwana Waziri. What we found it very fun is that we've gone to many hospitals, found mothers who have given birth, and they're...
Senator Hamida.
Yes.
You have asked...
Many
questions. Kindly yield. Senator Chirange.
Thank you, Mr. Speaker. Mine is Waziri Duale. Welcome and thank you. You are doing a good job. My question will be very simple, Waziri. This transition from Linda Mama to Linda Jamii, did we at any point lose the package of Linda Mama as you transit to Linda Jamii? Can you give us the package so that you debunk the street political fraud by Senator Kalwale, so that Kenyans, this is the only forum. We don't want Senator Kalwale to Kenya and mislead people that shifting from Linda Mama to Linda Jamii is a fraud. You have the opportunity to shine, Waziri. I yield.
Senator Meth.
Thank you very much, Mr. Speaker. Sir, mine is actually related to what Senator Akinyi asked, and I saw the maternal deaths report, and Nyandarua had the least maternal deaths report in the entire Republic. But my question was, Waziri, since these facilities that we have are run by county governments, is in terms of detaining mothers and their newborns, is there a policy in the ministry of as to how long a mother can be detained in a hospital because they're not able to meet their bill?
Senator Mungatana.
And thank you, Waziri, for the good job you're doing at the ministry. Mr. Speaker, we pay 2.75% of gross with a minimum of 300 shillings, or means testing is done and we pay 2.75%. Now, this is what Kenyans are paying. A question I wanted to ask you, Mr. Speaker, through the Minister, through Mr. Speaker, is that in this country, we have many other African nationalities who are living here. And maybe part of that report of deaths includes the nationalities who are living in this country from other African nations. I represent this Senate in the Pan-African Parliament. And the question is, are people covered? Those who are not paying, like those who are not paying SHA now, are they covered in this Linda Jamii? What do we do with them? How do you take care of the Congolese, the Zambians, the Ethiopians, and everyone who is living here? Your system of registration says *.147#, and if you go down, the next is these people don't have ID numbers. What do we do with them? They are with us here. They are still going to give you those maternal deaths. What do we do with them? What is the Kenya government on this matter? Thank you, Mr. Speaker.
Senator Nyutu.
Thank you, Mr. Speaker, for the opportunity. And allow me to just remind Waziri that the duties under the ministry that he has are very massive, Mr. Speaker, because you can actually live, you can actually borrow some food from a neighbor, but you can never borrow health from a neighbor. You cannot live without. Mr. Speaker, I'm just trying to tell the CS that he would do better to work more. That having been said and done, Mr. Speaker, I want to ask the CS, he has in his response about Linda Mama, he has said that they transited from Linda Mama to Linda Jamii. And one of the benefits that according to the response by the CS, one of the benefits is that teenage mothers. So my question then becomes, Honorable Minister, what is the ministry doing to see to it that there is prevention of teenage pregnancies in order for us to do prevention, because we have always been told that it is better than cure? That's my question, Mr. Speaker. Thank you.
Senator Gataya, more fire.
Thank you, Honorable Speaker. My question is very simple. What is the fate of thousands of Kenyans who cannot afford to pay SHA for themselves, Honorable Waziri?
CS, you may now proceed to respond.
Thank you, Mr. I'll start with the question by Honorable Senator for Uasin Gishu and the chair of the Health Committee. The matter was very unique to MTRH. That issue we have resolved. Those mothers who had, mainly they had no IDs, and, but we made our own contingency, and SHA has paid, and we have told the CEO and the current leadership at MTRH that that should not happen again. The question to my former colleague and senior Senator Boni Khalwale, and Senator Boni Khalwale, I will not take the advice of the Senator for Nandi, because I'm here to answer questions from senators in either form. Senator Boni Khalwale is also a medical doctor. I think the case you have mentioned first must be a very complicated case. of delivery for it to reach that level of 600,000. So that was a very complicated case. And SHA covered 60% of the bill. And this must be very clear. Even during the NHIF, there was no full coverage for NHIF. So SHA will cover the bit that is required by law to pay. There's nowhere where you have to pay 100%. I mean, even myself talking, I have patients, and the bill is $1 million, SHA pays 700, then the other 300 is an obligation on the part of the family members and of that patient. So, and I think we did our bit. If Linda Mama, there's no Linda Mama that exists. A transition was done, a more comprehensive, better Linda Mama is now anchored in SHA. And Honorable Speaker, I said it when I was answering the question. And in the answers that I have given to the Honorable Senator, if you look at it, there's a table. And I'll give you an example. Linda Mama, for level 2 and 3, were paying 2,500. For level 4 and 5 and 6, it was paying 5,000. And in fact, there was no equity. They were paying base and private, and less for public. The highest they have paid for cesarean was 17,000. Today, under SHA, it's more expanded, more comprehensive. Any delivery that takes place in our country are registered under SHIF, SHA will pay 10,000 from the 2,500 of Linda Mama. So Linda Jamii is paying 10,000 for cesarean, 17,000 to 30,000. That is progressive. And it covers comprehensively. For Linda Mama, it was only, Honorable Senators, through the Speaker, it was only for delivery. But for Linda Jamii, it is everything, surgical, anything that that mother and her child will require, even the treatment delivery. Under Linda Jamii is very comprehensive. I have given the data, and you can look at it. 2, it was budgeted, so the budget was not predictive. We inherited 4.2 billion shillings debt of Linda Mama. Today we will not inherit anything. Today we have no bill. Every in our country, and about 1.2 million mothers deliver in our country annually. We can give you those who go through SHA. Since SHA inception in October last year, are close to about 690,000. There are many who are delivering maybe at home. There are many who are delivering in private hospitals and paying for themselves. So my senior Honorable Khalwale, this mother could have had a bill of 500K paid, and I'm sure the balance the family will. But I think those are rare cases, are very complicated cases. No more delivery, no more cesarean. You are a doctor. You can do better. Again, with Honorable Mandago, let me just the package, the SHA package, benefit package that covers normal delivery at 10,000, and this package includes all that you require, procedures. This was not found in Linda Mama. It can only be found in Linda Jamii. So Linda Jamii has transited to a more comprehensive healthcare delivery system for our mothers. If a mother exceeds 3 days, as he said, the SHA package reverts to a duly bed rebate, which is found in the law that you have passed. So if a mother stays over 3 days, the hospital is to notify through our system the SHA and officers, and they will do it. Honorable Senate Minority Leader, I agree with you. We have a serious problem in the implementation of the private care fund. Level 2, level 3, and some of our level 4 sub-counties. Kenyan patient, Kenyans, all they need to do is to register as SHA members. They do need to pay because it is paid. It's paid by money appropriated by Parliament. But we have in few counties, and you have heard many times the President talking about it, where counties, some of the health facilities, they co-pay. They ask members of the public. In fact, if a governor or a county government wants to implement this, in all their level 2, level 3, and some of their level 4, they should put a sticker that walk in, walk out, and you are treated free. You are done lab test, you are given medicine, you go through everything. The money is paid by this government under the leadership of President Ruto. It has never happened. And this is what, and I think the Senate would help me, because the Senate oversights counties. Senate oversight counties. The health committee should go and do a report and identify. And we are ready to give you. There are 2, 3 counties we have found out, and we have told them, and what they are doing is criminal. It's criminal, it's against the law that you have passed. To Honorable Khalwale, I don't know whether it was you. The maternal guess you are giving for county is not correct. Yes. It's good you withdraw it. And I am ready to provide. There are many mothers who died, particularly when doctors were on strike. I have the names of the patients, of the mothers, and I have the names of the newborns. I think for record purpose, before the strike, they were doing well. I agree with you. Kiambu was doing well. But as a Minister for Health, I want to confirm to the nation that I agree with the union, with the doctors, that a number of maternal deaths occurred. And I'm ready to provide that evidence. So please, I don't want Governor Wamatangi to hear that and then says I heard it from the Senate. That information is not factual. Senator Nambwere, I think for the first time the anti-D is an injection. I think the doctors like Dr. Khalwale can explain. Is now for the first time is covered under SHA. This is one that helps in the spilling of blood. So this is a more comprehensive now which is found in the Linda Jamii than the Linda Mama, and the reimbursement for that injection alone by SHA is 6,000. The senator for Nyandarua, I think he has left. And it's not good, Speaker, that you ask a question and then you are not around. It's not, because you know what was the purpose of asking. But because I'm going on record and the senators are listening to me and the Speaker, let me answer. I think it's good to listen. Anyway, I've done it. It's okay. That his question was policy, and I want to tell him that policy does not allow definition, including mothers and newborns, in all our health facilities. And we really want him to report to us any such facilities for the leaders to report to us. And we have a call center. Citizens are calling 147, 24/7, and the call rate, dropout rate is less than 2 minutes. Any question they want to ask on SHA, they can get it. On Honorable Cherargei, the Linda Mama to Linda Jamii has enhanced the package. I totally agree with you. And why do I say so? The tariffs are better by 3 times the tariffs provided and benefits provided under Linda Jamii by President Ruto's government is far much better than the one of the old government. And why do I say so? In 2,500 to 10,000 for normal delivery, 17,000 to 30,000 for cesarean section. That alone, in terms of investment alone, is a big difference. And it's a very comprehensive complementary package. And it does not wait for a budget to be allocated. It is not a victim of supplementary reallocations. It is there. Secondly, the 400,000 teenage mothers in our country are fully covered. They just need to walk to any health center with their birth certificate or with their parents' ID, and now we have even developed what we call a special ID, a temporary ID for our teenage mothers. We don't want to encourage that. The Linda Jamii covers the whole family. It doesn't cover only the mother. Linda Mama was covering only the mother. This one is covering the child, even after they leave, so this is a more comprehensive. Linda Jamii now covers, Linda Jamii, Mr. Speaker, covers 28,000 per day. This was not present under Linda Mama. And I really want members to get to the back package. Linda Jamii now covers anti-D, as the Honorable Senator Nabwere have asked. I never used to cover that. I can talk the whole day if you ask me to compare Linda Mama and Linda Jamii. It's world apart. It's like first world and first world. So I think we must thank prevention of teenage mothers, advocacy. We must do a lot of advocacy, with our community leaders, with our church leaders. I think it's a responsibility for all of us. We should not promote it, but we have no choice. They are our children, but we must see how we can reduce it. We must ensure our girls enroll in schools and they stay in schools. That is one way we can. We must make sure that school health programs to teach girls and boys about changes of their premarital sex is part of our curriculum. We must have peer-to-peer support for all adolescents. Honorable Speaker, I don't know whether I have left. There was a question by the Senator for Murang'a, Mr. Speaker. I have read the law. I'm coming to the Honorable Senator for Tharaka. Cabinet secretaries by law, we are politicians and we will politic. And I want him to read the Conflict of Interest. I want him to read the Conflict of Interest Act, which was passed, which amended the Leadership Act. Anybody else in the public service does not do politics. But CSS, the law allows me, and I've tweeted it, and Honorable for Murang'a, you have me. I serve a political government, and the law allows me. If you change the law and says ministers should not politic, I will not politic. But for today, I abide by the law. I'm going to do politics. On the Senator for Tharaka. A very able president comes from. No do comparison. Respect for the former deputy president, about the current senator. Those Kenyans cannot pay is a very before NHI up for the salary history of NHIF, the former NHIF, only 0.8 in the informal sector have want to report in 1 year to celebrate 1 year of SHA. Over close to 1 million Kenyans in the informal sector have SHA. How do they do? There are those who can't, and they count and they pay, and can't pay. That produce. And I want to, since we have collected 150 million shillings. Kenyans go through, pay 4 months, lipa pole pole, daily, weekly, monthly, and as we over and paid through the SHA. So it's the bet is growing, and that is what is bringing the equity. And the speaker more, so that the lady in the market, the level of the society, they can pay 500, 600, totaling about those who pay up to 3. Answered all the questions. Yeah, foreigners, I agree with you. Number one, foreigners cards. Foreigners have different immigration documents. They can use those documents to pay for SHA. The United Nations High Commission for Refugees have signed an MOU with the SHA, and they have brought their people on board, all the refugees, to join SHA. Alien cards are allowed. They can go walk in and pay cash. They don't need to go through the system. And they can use any of the documents, because they must be using a document to stay in our country. They cannot just be in our country without a document. So the document that they will use can be valid for SHA registration. But the one you have seen, Honorable, my neighbor, Senator Tana River, is the one that is only meant for the people of Kenya.
Honorable Senators, we shall now move to question number 117 by Senator for Kisumu County, Senator Professor Tom Ojenda, and Senator Beatrice Akinyi asked that question on behalf of Senator Ojenda. You may proceed, Honorable Senator.
Thank you, Honorable Speaker, once more for granting me the opportunity to ask on behalf of Senator Ojenda, the Senator for Kisumu County, to ask the Cabinet Secretary for Health, 1, has the ministry established the exact amount of money lost to fraudulent claims under the Taifa Care Healthcare scheme from the recently concluded forensic review and digital audit by the Ministry of Health? If so, could the Cabinet Secretary disclose the amount and outline the steps being taken to recover the lost funds? The last question, what steps has the government taken to strengthen financial oversight over the Social Health Authority and its associated funds, particularly in respect of procurement processes, internal controls, and overall financial management? Thank you, Honorable Speaker.
Honorable CS, you may now respond.
Honorable Speaker, a very comprehensive, question 1, a very comprehensive forensic review and digital audit was commissioned by the ministry, particularly when I came for the month of, I think, June, July. And this review was executed by the Social Health Authority, the Digital Health Agency that is a custodian of the Digital Superhighway, and the Kenya Medical Practitioners and Dentists Council, together with their colleagues, the Clinical Council, who are the regulators. This review has leveraged on SHA upgraded structure, working together with the DHA to identify irregular claims, payments and anomalies which were previously undetected in the legacy of the NHIF system. The first one is on financial exposure. Honorable, the SHA system digital audit that led to the immediate and successful rejection of 10.6 billion in claims compliant and fraudulent, and preliminary estimates of this financial exposure related to these irregular payments are in the range of several hundred million shillings. A final verified figure will be communicated once the joint audit of the whole SHA system from October last year, when SHA started, up to this year is complete. This ongoing forensic validation is a proof of the effectiveness of the social health new architecture in uncovering and preventing fraud. And Mr. Speaker and honorable members, fraud globally is about 30%. And we must fight it. And it's not only with the SHA. And for the information of this House, I had a sitting with the other medical insurance, private medical insurance companies in our country. They are suffering, they are not making any profits because this fraud in our country, medical fraud, is systemic, is historical, and we must deal with it. Number two, what are the preventive reforms under SHA that we have introduced? And so far we have rolled out very robust reforms in order to strengthen governance, in order to put in place transparency and accountability. And how are we doing this? First, we have strengthened our AI-powered digital oversight. Our DHA, Digital Health Agency, has upgraded the next generation artificial and machine learning tools within the SHA claims adjudication platform. This system, Mr. Speaker, detects abnormal claim patterns. It detects inflated bills. It detects duplicate submission. And this is what we call automated pattern recognition. Secondly, we digital identity verification. The system links each claim to a biometrically verified beneficiaries, ensuring that only legitimate patients and providers are reimbursed, hence safeguarding the public money. Honorable Speaker, if this House is taken through, and I really want you maybe a time to call one to have a retreat to invite us, and we tell you, and I'll give you a good example. Honorable Speaker, when a child is born, when a delivery takes place in a health center, one of the critical documents that the health authority will require, apart from the claim form, is called birth notification. It's good, Senator Khalwale listens to me. He's a doctor, and I want him to go and say it at home. Yes. No, the whole of Kakamega County. Honorable Speaker, the document of birth notification is one of that must be provided with a claim for SHA to reimburse that delivery, reimbursement of or even for 30,000 for cesarean. When you don't submit a birth notification document, whether a child has been born or not, the question lingers. That claim becomes not payable. For example, again, and I am sure Dr. Khalwale and many doctors in the House will agree with me, if you perform a surgery, any procedure, and you want to do a claim, and the claim form is a legal document, and you have not attached theater notes, SHA will not, because that is not an evidence a surgery has taken place within a theater. But more importantly, we have discovered rules. a facility reporting that all the 300 or 200 deliveries that took place in that health facility were all. These are the kind of things the system is picking. We have picked where facilities have turned their healthcare workers into patients, where patients have been told, and that's why we stopped the 1 month contribution, where health facilities will go to the market, use their phone to register, use their phone to do a claim, just by getting the telephone numbers of the old ladies and the old men, either near the church, near the mosque, or near the market. What have we done to stop that fraud? Now we have geo-fenced facilities. No healthcare worker in our country, a doctor, can use his pre-authorization code outside of that health facility. You cannot do pre-authorization from the bedroom. And we want to stop when consultants and healthcare workers want to run health facility from the comfort of their bedrooms using their telephone. You cannot manage cases using telephones, Honorable Speaker. The second and most sanctions we have done, we have initiated a very structured recovery and accountability plan, including the immediate suspension of facilities, immediate suspension of doctors and clinicians who are found to have misused their OTP, and we have submitted we have closed 1,118 and gazetted in accordance with the law. We have submitted 118 files. And I am sure, including some of the staff of SHA, a number have been taken to court, and you might be seeing very, very, very big people going to court either this week or next week. We must fight fraud. The elephant in the room in the delivery of universal health coverage are crooks and fraudsters and thieves. And I want this House to help me when I come back, because we must protect public resources and we must not allow people to become wealthy by stealing money from sick people. That both us as leaders of this country, despite our political affiliation. Mr. Speaker, health is everything. For some of our colleagues who have really helped me, who say they are listening to the ground. In fact, on SHA, they are listening to the ground. Because Nyeri County is number 2 in SHA registration. That means listening to the ground is very important, particularly when it comes to SHA. Yes, for SHA, I don't know for other things. And Mombasa is number 1 in the country. We must thank the leadership of Mombasa County, because he is at 71% in terms of registration. Muranga is one of the top counties in terms of, and I want to thank Governor Kangata. I think he's focused, he's a very progressive leader, particularly when it comes to health matters. And there are many, many others.
Order.
Mr. Speaker, I have no mandate to give my views on the senator. My paycheck.
Honorable CS, yes. Do not engage the honorable senators directly.
Thank you, Mr. Speaker. I oblige. The second question, Mr. Speaker, was what has the government taken to strengthen the financial oversight over the Social Health Authority? Honorable Chair, Honorable Speaker and members, the government has initiated several comprehensive measures to enhance financial oversight, transparency and accountability within the Social Health Authority and its associated funds passed by this House. The Social Health Insurance Fund, the Primary Health Care Fund, and the Emergency Critical Illness Fund. How have we secured this? Number 1, we have strengthened the governance structure. Today, I'm happy to report that SHA operates under a fully constituted board with an oversight responsibility for financial management, audit, and risk functions. The Audit and Risk Committee monitors and assesses the financial. We have also enhanced the procurement controls. All procurement process within SHA strictly adhere to the public procurement and we have also complied with the directive of the President and the government on e-procurement system, not only in SHA, but in the whole of the Ministry of Health. It's being implemented, and this is to enhance transparency, ensure competition, and to minimize discretion in tender evaluations. We have also done automation and financial system integration. Members, SHA has deployed an integrated financial management system that links budgeting, accounting, and reporting functions. And this is to ensure real-time tracking of fund flows and promoting operational efficiency. Second last, we have very clear fund management framework. Each of the three funds under SHA operates under different distinct management frameworks with well-defined allocation criteria, with well-defined mechanism, and with well-defined investment guidelines so that we can prevent the misuse and diversion of funds. Honorable Speaker, finally, we have introduced a very independent audit and monitoring. Audits are conducted to assess our compliance rate. We and the Office of the Auditor General carries out an annual audit of SHA accounts to promote transparency and accountability in how we utilize this fund. Honorable Speaker, these measures I have said collectively reinforces accountability. They will safeguard public resources, and above all, they will ensure shilling contributed towards universal health care and appropriated by this House and is paid by the Kenyan citizens is used efficiently, transparently, only for the intended. Thank you, Honorable Speaker.
Senator Beatrice Akinyi, do you have any supplementary questions?
Yes, Honorable Speaker, I have. Thank you, CS, and keep going, because the health sector has to work. As part of the transparency and proper oversight of SHA, a proper database of all the health centers and hospitals eligible to SHA must be kept. Now, in your view, Honorable CS, how many health facilities are currently qualified and receiving money from SHA? And would you be willing to share that list with the Senate? 1. 2, Honorable CS, what is the waiting time by the SHA design? And do you think that waiting time, as in all insurance practices, working for SHA? Thank you.
Senator Cheriot, the Majority Leader.
Mr. Speaker, I want to thank the Minister for finding time and to respond to very important issues. Secondly, I want to appreciate that this is a very intelligent conversation, listening to senators raise issues pertaining to their constituents, particularly on this very topical matter of social health insurance, because it involves the people that give us a mandate to come to this House, Mr. Speaker. And it's very enlightening. Mr. Speaker, you know, sometimes I get very disappointed, and unfortunately, some of those people that I see in this House sometimes shout in funerals and rallies is not working. When the Minister is before us now, instead of, you know, it is allowed for a village blogger to say those kind of things, but not for a member of parliament. To ask the Minister questions like members are doing this morning on issues which the citizens are facing with SHA. I wish some of those colleagues were here this morning. That as it may, Mr. Speaker, I want to ask the Minister, particularly on Section 42. You know, this act, Mr. Speaker, is very dear to us as Senate. Mr. Minister, you may not be aware, but we passed the social health laws, all the 4 of them, in the sweltering Ghana. 4 days of extreme work, and therefore we understand this law fairly well, and that's why we continue to demand that it must work for our people the way we envision. 2 of that law, Parliament demanded that at the wording is within 3 months at the end of a financial year, Parliament is supposed to receive a report on the operations of Social Health Authority. I want the Minister to confirm to the House that in that report that he shall be sending, or perhaps even if possible, he can send a partial report to this House on 3 items that are very important to us as a House. Number 1 is on the spread of county compensations, county by county, so that we are able to know how much in compensation to public health facilities has gone to specific counties, Mr. Speaker. And I explain to the floor of this House why that is important. And I want that to be sent because I think it was Senator Mogenio who I had him say on the floor yesterday that SHA is not working. So I want to see if there's any compensation that is going to Nyamira County, as well as why I want this to be published, Mr. Speaker, is so that we are able to know if our citizens are accessing the services that they are being paid for, because those are the people that sent us to this House. And this is something that I have asked the Minister, including in our private conversation. The second thing that must feature in that report, Mr. the penalties, including the people that you have referred to, they are members of staff of SHA that are about to be taken to court because of issues of fraud. If there is something that can bring down this very noble initiative, Mr. Speaker, it is fraud. And therefore it will be important for Parliament to be appraised on how this system has been able to detect fraud, who are the officers that were involved, including the professionals like the doctors and the nurses and the people that you've said aid and abet this crime, Mr. Speaker, so that we are able to read out a list and know that there is a Dr. XYZ who works in Hospital Z in County Y, and this is what they attempted to do, and for that reason, they've been barred and they've been taken to prison, because that is where they belong. Because, Mr. Speaker, we moved the amendments. When this law came to Parliament, in conclusion, Mr. Speaker, I know I've taken long, but let me just make the final remark about it, Mr. Speaker. When this law came before the House, the penalty that had been prescribed, just like all laws that come from the AG's office, was just 1 million shillings. But we moved actually that fine from 1 million to 20 million Kenya shillings, Mr. Speaker, because it was in the best interest of the people of Kenya that anybody who tries to cheat the system is punished by law, so that we can save and help these facilities. Therefore, on that account, Mr. Speaker, I expect that the Minister will report of all the fraud that has been detected, the people that have been involved, not just the facilities alone, but the personnel as well that are doing this. Mr. Speaker, I'm concerned on the rate of rejected claims, particularly in the county that I represent in this House. I was at a public event, Kapkatet, a few weeks ago, and the citizens raised concern with me and said, of all the claims that we have filed, almost 50% are being rejected. What is it that SHA expects of us as a health facility to do? Therefore, Minister, you must tell us as a House, including your officers, to offer subsequent or sufficient training, Mr. Speaker. They don't service and those claims are rejected, because at the end of the day, particularly for public health institutions, Mr. Speaker, service has already been rendered and we don't want to sink them in debt. I thank you, Mr. Speaker.
Senator Shakil Abdallah.
Thank you, Mr. Speaker. Mr. Speaker, my question is, we know since SHA came, there are a lot of challenges, and that is working, it's working, but my one area which I'm concerned is the lack of clarity on the benefits of the coverage, which people at the ground. Because people go to seek services and they are told to pay, sometimes they don't get the services. So I am not sure whether the ministry, I know they did public participation, and did the ministry, or is the ministry in the position to do this clarification to the people to know what level pays for what, so that this confusion can stop. Because this hullabaloo cry of SHA not working, it's because of lack of clarity to the people, like SHA is paying for what, where. That clarity is not there, and this confusion is really hurting the people on the ground, Mr. Speaker, because people go for services and they don't get the services due to this confusion. So please, if the minister can tell us, how do they intend to handle this problem, which is really persisting in the ground? Thank you, Mr. Speaker.
Senator Karungo.
Thank you very much, Mr. Speaker. As I ask my question, it's also good for the good CS to note that when we ask questions for the benefit of the House and the public. So whether a senator is here or not here, just like Senator Ojienda is not in the House and he is answering good questions, the questions well. Medu is not in.
And that's why
we are
the
here
CS has
listening.
proceeded
Okay,
to
thank you. I
respond
just wanted to
despite
bring
the
that.
fact that.
Thank you. But in a rare support to the CS from me, Mr. Speaker, I would want to tell Senator Kalwale to stop reading Wamatangi Times and instead read the Kiambu People Times. Because for the last 150 days, Kiambu people have suffered because of the strike by the doctors, which took the Ministry of Health and the Council of Governors to assist. And now I can tell you are back to work. And I told the Senate, I have statements, I have even pushed the Committee on Devolution on nobody acted on that issue when it comes to matters Kiambu. The CS and his ministry and the Council of Governors, the Kiambu people now are okay. But I have a question to you, Bwana CS, because you have mentioned it twice now, that you're going to release the data or the statistics on matters Kiambu maternal mortality. Publish that and publish for all the counties, Bwana CS, because I believe with that information you'll help the Senate to oversight, take our oversight mandate well, Bwana CS. And finally, Mr. Speaker, some counties are not using SHA, they're charging cash, because probably SHA is on time, so they refuse to admit them and they charge cash instead. So I would also urge the CS to publish the SHA absorptions per county vis-a-vis the registration. Because you might have the number one in registration, yet when it comes to absorbing, so I think you should also publish that to help the Senate take our mandate. Thank you very much.
Senator Kathuri.
Thank you, Honorable Speaker, for giving this opportunity also to ask a question. But before I do that, Honorable Speaker, let me really commend the CS and his team. For this time, we are able to understand what is SHA, what is Linda Mama, between Linda Mama and Linda Jamii, Mr. Speaker. For the first time, CS and your team, then by your peers, Dr. Ruga and Mary Mudhoni, and also now the SHA CEO, Masi Mwangangi. Kenyans exactly what is happening. Didn't mention Waziri Nduale. You know, the course you need at the university was not mentioned, but the way you're explaining SHA and the health systems in Kenya, you are doing better than all the doctors I know, including Dr. Mboni, is not understanding some of the concepts that you are putting across Senator Waziri Nduale. But Nduale, even after thanking you that much, I have proven with the private hospitals and fee-based hospitals. Still, there is a problem because of that billion also amount that they are owned. And they are not able nowadays to treat. Most of them, they are demanding cash. We want to move from cash to universal health coverage. So what is your ministry doing to ensure that you are in good books with the private hospitals and the fee-based hospitals? Because like where I come from, most of the public hospitals are not functional. But most of the citizens, most of the people from Meru County use the feeding-based and private hospitals. So there is a challenge because they are not getting the health care that we need to give them. So you can give a brief on what is happening and what you're intending to do with those type of hospitals. I thank you.
Senator for Taita Taveta County.
Thank you, Mr. Speaker, for this opportunity to seek for clarification. Firstly, I've heard Senator Cheriot about hospitals that have not been refunded their claims, and I thought that before pre-authorization. So maybe it seems that like there is treatment before authorization. So I'd like to know which type of maladies or which situations require that there is pre-authorization and which ones don't require pre-authorization. But that was not my point. I was just riding on Senator Cheriot's question. The question is about payment for SHA. If I register for SHA and I pay, and after 4 months I get sick, and I go to a health facility, I'm required to pay for 1 year. Why is it so? And yet I'm up to date. And then you've also Lipa Pole Pole, SHA Lipa Pole Pole. When do I access it? Do I access it immediately? I register so that I go for SHA Lipa Pole Pole so that I pay for the whole year. And if I'm sick after, let's say, 5 months, am I still required to pay for a whole year? I think that is the clarity I would want. And finally, Mr. Speaker, what is the interest rate for this Lipa Pole Pole for SHA? Thank you, Mr. Speaker.
Thank you. Honorable Chute Mohammed.
Thank you very much, Honorable Speaker. Let me first of all take this opportunity to thank the CS for the hard work it's doing. Congratulations, na asante sana on behalf of the people of Kenya and Marsabit also. Secondly, the issue of employees, former employees of NHIF. Some employees from Marsabit asked me to ask the CS if they are not going to be absorbed by SHA. The best they can do is go and join other departments in the government. If they join that department, the salary they were earning before and the new place they are going to go to, the difference is huge. Remember, they've borrowed money before, they've borrowed for their cars. If they go to the smaller salary, they cannot afford to pay those installments. As Minister, what are you going to do to absorb those guys, the employees, former employees of NHIF, under the same employment and salary terms? Thank you.
Senator Mariam.
Thank you, Mr. Speaker, for giving me this opportunity. Mr. About the SHA claim, which the majority leader has a detail of it, but let me just frame it differently. Mr. Speaker, the CS explained that they have a digital oversight over their claim that can differentiate between, it can dictate the normal and abnormal one. Mr. Speaker, when we went to county visit, almost 23 facilities, most of them, they claim of about rejected claim. So why is it that this rejected claim, and if you have this system, can the normal and abnormal, see, you have to give the counties a leeway that they can do their part. They this rejected claim. Thank you.
Senator Mogo. Recha.
Thank you, CS, for explaining clearly the operations of SHA and the system in health sector. My question is, how can the ministry guard against governors that are killing the public side of medical practice, that is the hospitals, public hospitals, because they have theirs in town, so that people go to theirs in town and the government side is dead?
Senator Veronica Ndoti.
Thank you, Honorable Speaker, and thank you, CS, for what you have explained to the House. We really to get the detail of it, and I'm sure you have dealt with maternal and infant mortality late, especially because we have been alarmed by what we have seen in Kiambu Hospital. We hope that case is on your desk. Going to the SHA, our phones as leaders, the backstopping of where patients, when they go to hospitals, the frequently asked questions are actually coming to members of parliament and senators, as opposed to those questions going to SHA. What is the ministry doing to ensure that when patients go to hospitals, seek for emergency treatment in hospitals, they are quickly attended to without requirement for them to pay? And how are you ensuring that anybody who is in an emergency wing of a hospital, public hospital right now, and cannot be attended to because the hospital is insisting that they have not been paid the SHA claims, how are you ensuring they are given support and they are attended to so that they don't have to suffer the consequences of those unnecessary conversations on emergency units when patients need to be treated? Is there any support in that communication and supporting the patient to get access to the health services?
Senator.
Thank you, Mr. Speaker. I'm disappointed because most of the senators who were saying SHA is not working, like Senator Omogeni, are not here, including Senator Sifuna, but they are quick to yap in funerals that it's not working. Mine, Waziri Duale, is a very simple question. One, you want to ensure USC succeeds. What can you tell Kenyans that today SHA is working, and in terms of improvement of personnel that work within the value chain of universal health care? Waziri, you and me know that there was a presidential directive, and I know the biggest obstacle has been COG on the issue of coverage staff that have been on contract, but I'm happy through your guidance as the CS of Health, the SRC has harmonized their pay slips. What is the status in transiting these UHC staff to permanent and pensionable so that we make SHA works? And Waziri, can you use this for the naysayers and doomsayers, including Senator of Muranga, that SHA is working? Mr. Speaker, I find it painful that many people out there are quick to say SHA is not working, yet they cannot come and ask the gracious CS. And I want to thank CS Waziri Duale, because he's the only CS that has always before this. Unlike other CSs, I don't want to mention names because I will be accused of playing politics. But I know how to play it somewhere outside there, Mr. Speaker, not in funerals, but in birthday parties. I thank you.
Senator Essie Okanyuri.
Thank you, Mr. Speaker. Whatever I asked was on the issue of UHC staff, which Senator Cherargei has already highlighted.
Senator Boni Khalwale.
Thank you, Mr. Speaker.
Yes.
Mr. Speaker, I have listened in this House to the Minister and also in the media. When he speaks to SHA, he cardinal issues. the success of registration, and the challenges in the reimbursements. But in health delivery, the real issue is service to the people. The minister was in Kakamega on the 3rd of September. Because of SHA, St. Mary's Hospital has closed. And he told us that in 2 weeks, he will do the corrective measures and promised to the people of Kakamega that he has a roadmap for settlement of unpaid claims and for making sure that there is sustained delivery of service. Up to now, St. Mary's Hospital is closed. And some of my colleagues here, they want to play to the gallery and expect me to say SHA is working when St. Mary's Hospital is still closed. You want me, Senator Cherargei, I heard you. You want me, it's working.
Senator Boni.
Yes.
Senator Boni.
Can you contain him?
Address the chair. Senator Fernandi, allow Senator to make his point. Allow the Honorable Senator to make his point.
Thank you, Mr. Speaker. And therefore, when hospitals served by my colleagues and owned by some of them are owed 43 billion shillings by SHA, and NHIF is still claiming 33 billion shillings, how do you expect a clear-minded scientist like myself to say it is working? Anyway, Mr. Speaker, I want, with your indulgence, to allow me to ask the minister, you have a chance to clarify today. What interest does the chairman of SHA have in the so-called group of companies, in the so-called Metropolitan Hospital and /stroke Labdan Hospital?
Senator Newton.
Thank you, Mr. Speaker. And while I want to commend the ministry for unearthing the fraud that had been perpetrated, costing SHA about 10.6 billion Kenya shillings. Mr. Speaker, the working or otherwise of SHA, like the majority whip has said, will be out there, Mr. Speaker. It is the confession of people who actually benefit or fail to benefit from SHA that are supposed to tell the story, and not basically what the minister says here. And so, Mr. Speaker, it's important that through you we ask Senator Cherargei, to at least for once, act as a senator and not like that sycophant who only wants to talk about things that are working. Mr. Speaker.
Order, Honorable Senators. Are we not? Order, Honorable Senators. Senator Fernandi, Senator Fernandi. Senator Fernandi, Senator for Moranga, Senator Jonyut. I will not allow absurdity. Once you take to the floor, ask your question to the Proceed.
Thank you. I'm guided, Mr. Speaker. I only mentioned his name because he mentioned my name.
Just proceed to ask your question.
Okay, Mr. Speaker, there is an organization in this country, and this goes to the CS, Mr. Speaker. May I be heard in silence, Mr. Speaker?
Senator Newton, your statements are drawing this unnecessary interruption.
I'm asking my question as guided by you, Honorable Speaker. That's what I'm doing.
Proceed.
Can I be heard in silence, Mr. Speaker?
Proceed.
So my question to the CS, Mr. Speaker, is there is an organization in this country. Mr. Speaker, kindly protect me from Senator Cherargei.
Senator Fernandi, what is your point of order?
Mr. Speaker, standing order 101 and 105. Is it in order for the distinguished senator, our Munyora Deharan, to accuse me of being aside my legislation oversight work? Can he either substantiate or withdraw? We are not in a public library somewhere in Canon. He can go and do his politics there, but not here, Mr. Speaker. I'm a man who has protected my name, Mr. Speaker, and reputation. I cannot be allowed by first-time senators to come and insult me.
Senator Newton.
Thank you, Mr. Speaker. You would think that Senator Cherargei was born a senator and calling others a first-time senator. Yes, I am a first-time senator, Mr. Speaker, and proud to be so, because Mr. Senator Cherargei was one-time senator.
Senator Newton.
Okay, my question.
That is not the point.
My question, Mr. Speaker.
Senator Newton, can you?
I'm asking my
listen to
question.
the chair?
I'm asking my question.
Order, honourable senators.
I'm asking my question, Mr. Speaker.
Senator Newton, you
Yes,
will
Mr.
take my
Speaker.
instructions. So be quiet as the chair gives directions. A point of order has just been raised by the Senator Fernandi, that you've gone ahead to call him a sycophant. His point of order is, would you substantiate that statement? If not, then you proceed to withdraw and apologize. And ask your question.
Thank you, Mr. Speaker.
That's a point that has been raised. You cannot interject. Proceed.
Thank you, Mr. Speaker. And I know an impartial judge, Mr. Speaker. Mr. Speaker, even as I follow your advice and guidance, and even orders, Mr. Speaker, refer to me as our Munyoro adherent. Mr. Speaker, probably, to be very fair, do we have such an outfit in this Senate? And so, Mr. Speaker, I think let it be eye for eye. For an eye, Mr. Speaker. He has
Order.
referred to me.
Honorable Newton.
Yes, Mr. Speaker.
Honorable Newton, we cannot where absurdity breeds absurdity. I expected you or any to raise on a point of order. The Senator Fernandi having called you that you're a, what was it again? Wamnyoro? Absolutely. No point of order was raised on that particular assertion. The chair cannot intervene. But your assertion to the fact that the Senator Fernandi is a sycophant has attracted a point of order. Yours did not. In fact, I did not hear you in any way trying to raise a point of order on that assertion by Senator Fernandi. Nevertheless, the two senators, Senator Fernandi and Senator Newt. Senator Fernandi, you will proceed to withdraw that assertion. Thereafter, the Senator for Muranga will proceed to withdraw the assertion calling you a sycophant. And thereafter, you will proceed to ask the minister. Senator Fernandi, proceed to withdraw that particular assertion.
Mr. Speaker, the word...
Withdraw that assertion.
Mr. Speaker, as I will is the word adherent means you support an idea or party. So it is good that the Senator has gone on record that this does not support him. So thank you, Mr. Speaker. I withdraw and apologize. Let the people of Muranga watch.
Senator Newton, proceed to withdraw that assertion.
Thank you, Mr. Speaker, and I'll follow the cue from the experienced senator from Nandi and say that a sycophant is only somebody who says things to please somebody else somewhere. And apologize, and Mr. Speaker, now proceed to ask my question to the Honorable CS. Mr. Speaker, I was just of the CS that there is an organization in this country called RUFA, meaning Rural and Urban Private Hospitals Association. And hospitals under that particular association are not offering services covered under SHA. And Mr. Speaker, then my question to the Honorable CS is exactly what plans are there? Because these hospitals serve very many Kenyans, Mr. Speaker, and without them recognizing SHA, then many Kenyans. That was my question, Mr. Speaker. Thank you. And thank you for your Solomonic wisdom. and your impartiality. Thank you, Mr. Speaker.
Senator Osotsi.
Speaker. Mr. Speaker, I want to ask my good friend CS a question on the state for NHIF reimbursements, which if there is any breakdown that he can give this House. Because as we talk about SHA, we should also be alive that there has been long outstanding debts owed to these hospitals by the defunct NHIF.
Honorable Chair, Honorable Speaker, let me start with the first question that Honorable Beatrice. For record purpose, from the Kenya Medical Practitioners and Dentists Council, Honorable Speaker, that registers all facilities. The total number of health facilities registered in our country are 14,876, out of which public facilities are 6,005. Two, on the same by Senator Beatrice, some facilities, some county facilities have remained unpaid, particularly for the primary health care facilities, PHC, about 200 of them. And we cannot pay them because of their bank accounts. And we have communicated this to the Council of Governors, Secretariat, and the leadership, because we want to protect the reimbursement, the money, and the Council of Governors is coming back to us. And COG is working with SHA to ensure that they update for the primary health care. And two, still on Senator Beatrice Ogola, SHA has a database with a very active number. Now the ones who are registered under SHA, both public, private, and faith-based, are 10,451 facilities having a provider portal rights. And payment for these facilities is dependent on the claim review process. Every claim on our dashboard in our system, even when it is rejected, it will give you the reasons why it's rejected. If you have not submitted required documentation, you submit the following documents within 14 days. And different claims are in different, some have just been submitted, some are under review, some have been approved for payment. So it's like a whole ecosystem. Our digital system, we call it the digital super highway. When I come to the question raised by the leader of majority, Senator Aaron Cheriot, I agree with you, we will comply with the law, and we will, Honorable Speaker, through you, we will give this House any information that is required within the shortest time possible, and I'm sure the members and the chair and the vice chair of the Health Committee know that whenever I am called, I appear. Just for example, to give you, under the PHC, the primary health care, which is exchequer funded, a very unique thing under this leadership. The problem, people who are opposing SHA are not the patients, are not the health facilities, are people who have a problem with the government of President Ruto. Today, as we speak, Honorable Speaker, over 27 million Kenyans have registered SHA. Mombasa leading, Nyeri number 2, Kirinyaga, Bomet. That's how I can give the list of all the counties. And under PHC, so far, the primary health care, we 5.6 billion since last October. And we are ready to provide county by county, faith-based facilities who attend to Kenya for this free primary health care. We have given them 745 million. We can give the list one by one. Under chief, county governments have so far, depending on how they do their claim, there are some county governments like Mombasa, like Nyeri, like Nakuru. And let me say Nakuru PGH is one of the best model that is implementing the social health insurance fund. Since October, Nakuru PGH and Coast General Hospital have received close to $1 billion shilling because they do manage their claims properly. The faith-based organization have got about 12 billion. MOH, these are the referrals. Kenyatta University, MTRH, Madare, and all these. They have received 6.5 billion. The private facilities are the largest who have received under chief, 29.3 billion. This report is ready to the House anytime we are required. The animal or the elephant in the room is rejected, and I want senators to listen to me, Senator Cheriot being. If you see somebody asking you, there are a lot of rejections, he doesn't want to come and face. In SHA, we have relationship managers at the county, at our headquarters. Our system gives you reason. We have men and women, doctors who do clinical review, who will tell you why you are rejected. But because they know those are fraudulent, those are frauds, and we are coming for them, Senator, tell them we are coming for them. And why claims rejected? I want to give you 5 reasons why claims are rejected. And once it is rejected, for the information of this House, we are not paying. Claims are rejected because there's no claim form. The law you passed here, the 4 laws, at the bottom of those laws, you have designed a claim form. So a claim form is a legal document. If a facility has not provided a claim form when they are asking for reimbursement, that's automatic rejection. If the facility has not given us itemized invoice, that is a if there are no discharge summaries, God forbid, let me pick on even Senator Cheriot or Senator Khalwale. You go to Nairobi Hospital, 2 days, there's no discharge form. And it's deliberate because they want to claim 30 days when that patient has stayed for only 4 or 5 days. So if you don't give us a discharge summary on when the patient, that is a rejected claim. If there are no supporting theater, if a patient, a Kenyan citizen, who is a member of SHA, paid up member of SHA, goes to a theater for any type of procedure, and then you make the claim to the Social Health Authority for reimbursement, and you have not attached theater notes, doctors who are in this house will know that. I am not a doctor, but I read, and I learn from people I work with. If there are no theater notes, that's a rejected claim, and we will not pay. If there are no birth notification, if a delivery has taken place in any of our health facility in our country, the mandatory document is a birth notification. If you want us to pay for your delivery, whether or normal or cesarean, and a birth notification is missing, we will not pay you. We cannot confirm whether a child has been born, whether a delivery has taken place. It's rejected, Honorable Senator for Kericho. Upcoding. There are people, and this is a medical fraud. There are people, for a small boil, that takes about 1 hour. The claim they make is that they have done a bigger procedure by even cutting his hand. That is called upcoding, and the system will pick you, we will not pay you. If you convert outpatients into inpatients, that is the biggest fraud. There are Kenyans who go, they are treated, they go home, then the facility turns them into inpatients because they want to claim the bed. They want 5 days. But now, going forward, they cannot do it because now we have introduced the biometric. A Kenyan must go through the biometric when he goes to hospital, through biometric when he's being discharged. But before the biometrics, they were outpatients, and we have got evidence of patients who have gone even to the DCI, who are saying, I went for a day. Why is this facility claiming 14 days? Honorable Senate Majority Leader, we will not pay. And please tell these people who tell about rejected, let them go. They will get all the explanations. As of today, SHA does not pay. As of today, faith-based, and let me pick, and I want Honorable Kalwale to listen to me. St. Mary has been used for many months for political expediency. It became the talk in funerals and everywhere. I went and sat with the Bishop of St. Mary. I sat with the Bishop of St. Mary, with the whole of my team, including the bank manager. And we have shown our Lordship, the Bishop, that SHA has paid him 90 million shilling. We have given him the TT, the transfer. The balance that at time had was 14 million. We have paid the 14 million. It is you now to go and ask the bishop why he's not opening the facility. In a press conference. And I said it. And I said it. Let us not use, St. Mary for politics. And I'm saying it, and I'm sure the people of Kakamega are watching me. Look for something else. St. Mary is a closed chapter. You cannot use St. Mary, a church, a faith-based. We have the numbers. Before the end of the day, Senator Bonnie, I have sent to you on your WhatsApp more than 5 times. You did not respond to me. I gave it to Prime Cabinet Secretary. When nobody could hear, I flew to Kakamega. And I sat with the bishop. And we did reconciliation. We proved to him that we have paid him 90 million. If today I pay Nairobi Hospital, for example, and the management decides not to run the hospital and close it, that is not a function of the Minister for Health. But for my brother, served for many years, St. Mary has received as of today, because we have the system on our phones, as of today, 148,896 as of October today. And I am ready to be held account. Number 2, St. Mary is active in our provider portal. We have not suspended it. They can admit patients today. They can see anybody. It is not us. Number 3, our system is real time. Number 4, St. Mary owes us 8.5 million, and all these were lodged by the 14th of November, our next payment cycle. If these 8.5 are verified, we will pay. But so far we are paid 114. And please help me. I'm sure this weekend you'll be in Kakamega. I want you to have a different story. To say that St. Mary, St. Mary, the problem is the management, is the leadership, and I am ready to go with you. Yes. I am ready. But SHA is working. SHA is working. Mr. Speaker, SHA is working, and I have said, you can have a problem with the President Ruto's administration, but SHA is working. It is unimaginable every day between 25 to 30,000 Kenyans register voluntarily as members of the SHA Social Health Authority. The train has left. Many people could not implement. because of many side issues. Senator Kathuri, my Deputy Speaker now on the chair, I agree with you. The faith-based settlement rate is at 69.
You know, Senator Mboni, why are you interrupting the CS? You know the CS is not even in the side of the House. That is why you cannot raise a point of order. Maybe after he summarizes his question, you can seek clarification. But not a point of order to the CS. You know it. Please, I told you, let him finish the questions. Actually, he's answering the questions for the US truly. You should be very quiet.
Thank you, Honorable Speaker. Honorable Speaker, your questions, yes. Hospitals, our settlement rate is 69%. Private hospitals is at 56%. Public hospital settlement is at 55%. And this is delayed because. But the matter that you have raised is very critical. And this is a discussion for the Senate and for the Council of Governors. The people who work in our counties, facilities, own private facilities next door. They own facilities, and I've told governors. So they work at the counties as retention, but they really do their business. And I'll give a good example of Kakamega. The number of patients seen in Kakamega public hospitals and the amount of drugs dispensed does not tally, which means the drugs are being taken at facilities. And that's why I call upon this great house, which is a custodian of devolution, and which has a Senate Committee and Senate Health Committee, to go out, because health is devolved. There's very little I can do, and make sure and ask what is happening. We have seen facilities we are closing that are owned by people who work in county governments. So we need to deal with that, Deputy Speaker, who is on the chair. Honorable Veronica Maina, yes, the emergency cover is active now in level 5, 6. We were doing a pilot phase, but I want to assure this House that the emergency cover will be up and running on December 1st. The centers in all level 4. Our ambulance services, ECCIF, will be launched in December. And this is one of the beauty about universal health coverage. Never again will a Kenyan on an emergency go to a hospital and he will be asked for a deposit. The emergency center we are going to establish will send the nearest ambulance to that Kenyan who is in distress in terms of health. It will take him to the hospital. The ambulance is paid by SHA at the rate of 4,500 if it is a long distance in every 25 kilometers. And then when he's delivered to a health facility at any level, that Kenyan, the first 24 hours is free. This is the kind of transformation and this president has. Let me talk about RUFA. Number one, SHA does not deal with organizations. And I know the leader of RUFA. The leader of RUFA is called Dr. Brian. He competed against Dr. Boni Khalwale. And he lost to Dr. Boni Khalwale. And he wants to use SHA to get political engagement in Kakamega County. So he has a choice to make. He has a choice to make. Speaker, let me say it. If the truth is hurting Senator Boni Khalwale.
Honorable CS, just a minute. You know, I want to protect the Honorable Senator for Kakamega. Stop directly, just make your comments. But without referring to him, I'll give you seek clarification. I'll give you later. Let him finish.
Chairman, let me finish.
Let him finish.
Because the great senator of Muranga has asked me.
Just cool. I will give you that opportunity to raise your concern.
Mr. Speaker, do I have the floor?
Honorable Nikarwale, Senator
Mr. Speaker, what I am
Order,
giving this
Senator
out,
Boni.
I am going on record, is fact, and the Honorable Boni Khalwale should hold his horses. Because Rufa, the leader, the chair of Rufa was his competitor in last election. That is a fact. That is a fact, it's not deniable. Number two, Rufa is an organization, has specific contracts with the over 10,000 facilities. So we don't have a contractual obligation with a Rufa, with any organization. And let me in fact say today, for the avoidance of doubt, Rufa, Private Hospital Association, the Faith-Based Association, the Council of Governors, I all of them engage them as organization. But the people who have contractual obligation, who must follow the law, what they have signed, whether in faith-based, whether in private, whether in public, is in hospitals in our country, because they treat patients individually. There are no patients which are treated by organizations. To get the accountability must be on the person or the facility that has signed a contract. So Rufa, the issue is they do a lot of press conference, they can continue. They can continue. Because Kenya is a free country. On the issue of the debt of NHIF, I agree. The biggest problem we have, and that is even making the debt of the 30 billion of NHIF has brought down facilities. Some facilities are getting closed. Came to the ministry, I set up a very independent committee to verify. Edward Awuko, our former Auditor General, is verifying the pending bill of the national government. And he was given a pending bill of 506 billion. He could only verify what we saw in cabinet. I think it's about 206 billion. Some people disappeared. Some did not bring their documents. The same law that tells me I should pay is the same constitution and the PFM Act and tells us sitting on this side and subject to your oversight that I must pay public funds. Now what I have done is the people who are owed by NHIF between 1 shilling to 10 is about 5.3 billion. Some of them even are owed 300 shillings. And I can provide the list to this house. I have written to the Minister for National Treasury, and that 5.3 billion accounts for of the total debt of these people who owe NHIF. The rest are big people. So I say let's first pay the 5.3 after we verify. We have now started verifying. I have written to the National Treasury with the blessings of the President after consultation, and by the time the supplementary comes and we have finished verifying, I want to assure the people of Kenya we will pay the 5.3. Secondly, the rest I have also asked a team led by same Auditor General, because his pending bill committee is alive, the auditors from SHA, MOH, to sit down and verify, and we must pay that, whether it is 10 billion, 50 billion, we must pay, so that our facilities, our people should not lose their investment. There are facilities that are having financial challenge. Let me be very honest, because of the old debt. With the SHA, we're supposed to pay by law within 90 days, but we pay within, if your bills are verified, within every 14th day of every month. Honorable Speaker, Senator Chute asked why all NHIF staff. It's a very, very good question. All NHIF staff were about 1,800. But the law you created reduce that number to about 800. So we have a balance of 1,000. First priority in terms of recruitment were given to NHIF, to ensure NHIF staff. Those who will not secure SHA, and I have documents I can place before this House, they will be absorbed in any of our other public institutions at the same salary and package that they were at NHIF. I have agreed with the court, and we have said, and I have a letter from public service, a letter from the head of public service, to that if we want to tell our staff, the Kenyans, because I agree with you, they had mortgage, they had many things. If they go, for example, to my ministry, or they go to, they will not earn a new salary. They will earn the salary they were earning at NHIF, and they will be placed at the grade, if not better, than where they were at NHIF. I think, so Senator Nyutu, please tell the roofer, I don't deal with, when it comes to money, facilities, the CEO will deal with people who have. Yes, the question about the chairman of SHA. Yes. The chairman of SHA is Abdi, and Dr. Kalwale knows. Dr. Abdi does not own any facility. Now, and even before, few months before he became chair. He had a historical ownership. He had a historical ownership of Ladnan. He had an historical ownership. And in fact, it is Ladnan that bought Ladnan. And you know the owner of Metro. It's one of our most progressive health facility provider. And I think it's not good. Kenya, you know, it's like there are people who are saying, Aden Duale owns a facility. My assets and liability are within the records of Parliament. I was vetted by Parliament. What I own, if I own a chopper, I own a chopper. If I own camels, I own a camels, and they are in the documents of Parliament. So Dr. Abdi does not own. If he owns a facility and you have approved, we will remove him as a chair of SHA. But we will not allow people to smear other Kenyans, because Dr. Abdi is other, to smear other Kenyans, even if it's Dr. Boni or Dr. or Cherargei or Senator Veronica. Politics, we will go by the truth. Honorable, my good friend, my leader of the whip, I want to assure you that he does not own. In fact, the Health Committee of the National Assembly visited London, they visited Metro, and they perused all the reports available, and they confirmed the ownership is not with Dr. Abdi, a committee of this House. I think, Honorable Speaker, I don't know whether I have left. UHC. Okay. Oh, yes, UHC. Yes. Yes, let me start with Honorable the Secretary General of one of the biggest party.
Stop heckling.
Honorable Shakila asked about our benefits. Our benefits are in the by these houses. And the clarity is in the regulations. What is lacking, and Honorable Shakila is saying, is we have asked hospitals to put posters in every place in the hospital to show this is the package for oncology, and we will do working together with SHA. We want leaders, all of us, on sensitizing our people. Even last night, if you
Senator Shakira, why are you shouting from your seat? Why? No, that is not the way we transact business in the Senate.
So we will do. And then the issue of UHC.
We have no time.
The issue of UHC, Mr. Speaker, and I want to thank Senator Cherargei, just like Senator Khalwale, they represent a wide range of constituency. that is Cherargei, that is constituency. But these Kenyans, 7,000 plus, have suffered for too long. They were employed during the COVID. They did good work. They are still doing good work. Part of what we did for the achievement and the attainment of a complete universal health coverage, healthcare workforce is the most important pillar. And that's why we fixed the internet. That's why we did all the health bargaining agreements. That's why you see doctors. Now, UHC, we have government. We have the salary, we have the allowances, we have everything. The president has committed in public that the national government will pay. And we have so far put them under the SRC rates. So they earn very good money now. What is remaining is a transition from contract to permanent and pensionable. And because they work in the counties and they are under the public service, I'm still engaging with the county governments. But I'm a bit frustrated because they don't see how these Kenyans are suffering. But again, I am ready. The chair of health committee is sitting on the house, Honorable Mandago. You have some powers more than me on as a custodian. You need to call us. The money is available, allowance is available, everything. Ask the governors why they are not transiting these good people to permanent and pensionable. And if they I can take them. I can take them to our referral hospitals. We have a huge shortage. So that these Kenyans can have that choice. And Chair, I think that is Sha Lipa Pole Pole, yes. Sha Lipa Pole Pole has no interest, has no fees, has no levies. It is free. You pay 4 months, the other 8 months. After you go through the mean testing, if the amount is 7,000, you say you pay the other 8 months daily, weekly, or monthly. Every day, over 2,000 Kenyans go through Sha Lipa Pole. If you don't want to do that, there is nothing we can do. 651 things we have collected since the president announced Sha Lipa Pole Pole in Homa Bay first day. So Sha Lipa Pole is working very much. If you see somebody who doesn't want to do that, then as some senator said here, you can live with illiteracy, but you cannot live with the sickness. I want to urge Kenyans, universal health care is working. Please let us register en masse for Sha. Let us protect our children and our next of kin. Thank you, Chair.
Thank you. Senator Boni, what is
there was a question from the senator for Kiambu.
Under 1 minute. Just a minute. You will answer with together with
Mr. Speaker. The senator let me answer the senator for Kiambu. I agree, and many people agree with me. The maternal and child is not very good. It should be a national discussion. I have agreed with the president that we must make it a national discussion. Leaders must make it a national discussion. We have about 20 counties that are doing very badly. Name them. And we are going to shame them. Secondly, we are putting in our digital superhighway as a system where every facility in our country must report maternal or child death on a daily basis. And they must give the reasons. They must give the reasons. And this is real. Our neighbors are doing better than us, all of us. A mother walks to a hospital, she is not a patient. She is very happy. She wants to come out happy with a baby. She is going to a facility to give us another life. We cannot, as a country. It is immoral, it is unacceptable, it's unconstitutional to have the maternal child mortality rate we have in our country. And I think as our leaders, both in all the three arms of government, our religious leaders, we must do something. Our women must do something. But as a Minister for Health, one of the legacy that I have to leave as the Minister of Health.
So we have like 5 minutes. Dr. Boni Karore, under 1 minute, seek your clarification.
Mr. Speaker, the reason why I rose is not because my question was... I was rising to appeal to the minister that this hubris is the demonstration of power. You cannot disrespect...
There is no clarification.
Mr. Speaker, this is House of Debate. Brian Lichenga find it okay and be unable to speak about Dr. Abdi unless you are in office to let some people.
No.
Number two, you cannot...
Senator Boni Karware. Minority Linda? Minority Linda? Senator Boni Karware, I will like kick you out of this house the rest of the day.
But you see, this is what...
No, that is not the way we transact business, and you know.
And now he's here, you think you can...
Senator Boni Karware, Senator Boni Karware.
Managing the National Assembly and the Senate? Really?
Senator Boni.
You think I don't know how government works?
Minority Linda, progress?
Yes, asante naibu wa spika. Nilikuwa nataka kuuliza lile swali ambalo nilikuwa nimeuliza hapo awali ambalo waziri analijua, na huu mswada wa kwamba waziri yuko hapa hivi sasa umezua mwamko mpya.
Senator Mudigi,
kwamba
allow the CS to get the clarification that the minority leader is seeking.
Katika kaunti ya Kilifi hivi sasa kila mtu anafuata hii debate ambayo inaendelea hapa, na ingekuwa vizuri sana ikiwa bwana Speaker utaniruhusu nimuulize waziri lile swali ambalo hapo awali aweze kulijibu kwa lugha ya Kiswahili. Manake mimi nimeuliza Kiswahili na yeye lazima anijibu mimi na lugha ya Kiswahili bora zaidi, ili watu wangu wapate kuelewa masuala haya ya mamlaka ya afya ya jamii. Sijui kama bwana waziri anaweza kuniruhusu, bwana Speaker unaweza kuniruhusu niulize swali. Katika
si amekupata
katika masikilizano yale ambayo alikuwa ameyafanya hapo awali, huyu waziri, wagonjwa wakienda hospitali, akina mama na watoto na jamii wakiwa wameenda hospitali ile level 1, 2 and 3, kumekuwa na tetesi kwa sababu hivi sasa wao wanachajiwa, na hali mkataba uliowekwa na waziri pale ilikuwa ya kwamba watu wakienda level 1, 2 and 3 wapatiwe matibabu alafu